we will start recording. In ಕಾಣಿಸ್ತಾ ಇದೆ ಗೊತ್ತಿನ ಆಪ್ಷನ್ ಗೀತಾ ಸ್ಟಾರ್ಟ್.
Yes, ma'am. Yes, ma'am.
ಗೀತಾ ಸ್ಟಾರ್ಟ್ ಆಗಿದೆ.
Om Dhanvantare Namaha. Good afternoon, everyone. I am Dr. Geeta Pottur. Welcome you all on behalf of Raaaous. Today will be very exciting and informative session. Especially he is my classmate and very talented doctor, I can say. Today's speaker, Dr. Basavaraj. I am welcoming you to this group. Welcome, Dr. Basavaraj.
Thank you, madam.
And so we'll start this session with prayer by Dr. Kanchana. Over to you, Dr. Kanchana.
Thank you, Shakuntala ma'am. Thank you, Dr. Geeta. Om Namami Dhanvantari Adidevam Shurasurai Vandita Padapadmam Loke Jararu Ayamrutyu Nashanam Dhataramisam Vividausadinam Dhanvantari Ramanatam Sarvaroga Nivarakam Ayurveda Pravaktaram Vande Piyushadayakam Sarve Janaha Sukhino Bhavantu Om Shanti Shanti
I request everyone to mute the gadgets to avoid the interruption. Please mute the gadgets. Dr. Satish sir. Dr. Satish sir. Okay, thank you. Now I request Dr. Shakuntala ma'am, our founder of Raaaous Group, to give brief insight about our Raaaous Group. Over to you, ma'am.
Om Shri Dhanvantare Namaha. So I actually welcome Dr. Basavaraj sir because since 1 year we are waiting for sir slot. Sir is so much busy and he is so much talented. Thank you so much, sir, for taking your valuable time and sharing your experience to Raaaous Group. Raaaous is Rudra Arbuda, Ayurveda approach under one shelter. As name suggests, intention of Raaaous is to bring all Ayurvedic cancer specialists under one shelter. Through these webinars, we are inviting experts to share their knowledge and discuss with other teammates to enhance our knowledge and build a network in between all of us. And Raaaous is conducting many activities, like we are conducting a screening camp, we are conducting online and offline awareness programs regarding cancer, and we are conducting workshops, and we are conducting very it is very interesting classes every day. Weekly, we are conducting 2 classes on Monday and Thursday. One is regarding purely yoga and another is regarding cancer. One cancer we will take and we will discuss 2-3 months. Like that, yoga is also, for one yoga, it will take 2 or 3 months to complete. So, classes it will take for one. And we are conducting educational trips. We go outside and we see what the others Vaidyas are doing to share and build our knowledge. So some of the activities like this we are conducting, and by this, with a Dhanvantari blessing, hope we are continuing to reach other states. Now we are 14 state members, and if I'm not wrong, 484 Raaaous team member. And one thing I'm happy to announce that this January 3rd, the Raaaous Trust has started. Like with 5 trustees, we have started one Raaaous Trust, and Raaaous family is like family. Why I'm telling this again and again? So each and every members of Raaaous, they are connecting each other and they are supporting each other, build our knowledge, build the support whatever needs for other family members. This I can see the love and affection, I could say, or that support as a family member we are, as a backbone we are giving to everyone is giving. It's not one person who has started this group. Everyone is giving to everyone. This things actually, uh, in this cancer, I'm really happy that is with the God, Dhanvanti blessings. And all delegates, welcome to Ross this webinar, 38th webinar, and welcome sir once again. Over to Dr. Geeta.
Thank you, ma'am. Thanks for the info. Now I request Dr. Amulya to introduce today's speaker, Dr. Basavaraj Swami. Over to you, Dr. Amulya.
Thank you, ma'am. Hari Om Dhanvantri. Very good afternoon to one and all. So it's a privilege for me to give a brief introduction about today's eminent speaker, Dr. Basavaraj Swami sir. So Dr. Basavaraj sir has completed his BMS from TMAE Ayurvedic Medical College, Hospet. Along with this, he has also done registered certificate course in Kshara Sutra from IPGT R and A from Jamnagar Institute. Along with this very special, unique course he has done is LLB from SS Lahoti Law College, Gulbarga University. Sir has over 23 years of experience in Ayurvedic clinical practice. And one more good thing is that even his wife, Dr. Savitri B. Swami Madam, she is also an Ayurvedic doctor. Sir is running an Ayurvedic hospital in Bidar district, Karnataka, by the name Sanjeevani Ayur Care Hospital and Research Center, which is located in Basav Kalyana, Bidar district. So apart from this, apart from the Ayurvedic clinical practice and everything, he is also involved in many activities, and he is a member and president of so many institutes and organizations. To name few, he is a president of NEMA, Bidar district. Then he is also president for Patanjali Yoga Samiti and Bharat Swabhiman Trust, and he is also president for Karnataka Janapad Parishad. So apart from this, he is helping the society and serving from past 30 years by conducting so many health camps, then yoga camps, so many awareness camps amongst the people to promote the Ayurvedic science. And for all these achievements, he has been given so many awards, and few to name are Ayurvedic Sevak Award, Sri Channaratna Yogiraj Nagabhushan, then Sri Vaidyaratna Kallimatad, then Kalpavruksha Award, ಕಾಯಕದಲ್ಲಿ ದೇವರು ಕಾಣುವ ವೈದ್ಯ, then Karnataka Rajyotsava Puraskar. So such great honors he has been given. So we are very glad to have you, sir. It's an honor for us, and definitely, and the topic is also very interesting. So many will be eager to learn more, to get the knowledge about Rakthamokshana. Though they would be practicing, your experience and your successful cases which you will be presenting us today will surely enhance the knowledge of the listeners. Thank you so much, sir. Once again, welcome to the session.
Thank you, Dr. Amulya. Really, it will be a very exciting session. It will be, I think. Now I request Dr. Basavaraj Swami to start the session. Over to you.
Thank you, madam.
Sir, one request, like your PPT is not visible, sir.
One sharing is sharing.
Now
Okay. It's
Okay,
visible.
okay, okay. Okay, madam. Okay. Is it audible, madam?
Yes, yes.
Okay. Om Namo Bhagavate Mahasudarshana Vasudevaya Dhanvantariye Amrita Kalasha Hastaya Sarvabhaya Vinashanaya Sarvaroga Nivaranaya Om Trailokyanataya Trailokyapataye Sri Mahavishnu Swarupa Sri Dhanvantari Swarupa Om Sri Sri Aushadhi Chakra Narayana Swaha Narayana Swaha. First of all, saluting the Lord Dhanvantari and Ashwini Devatas and all the Charakashruta Vagbhatadi Ayurveda Acharyas. today a very interesting to say that Rakthamokshana. Here I am doing. So from last 20 years, I am practicing Rakthamokshana. So today my topic here I want to highlight few cases which are very encouraging, that which we have got the results. First of all, I am not going to explain in detail of the theoretical aspect today, but whatever the results we found in Ayurveda, why Rakthamokshana has considered as half of the Chikitsa in Shalya Tantra, that inspired me to work on this Rakthamokshana Chikitsa. So today, Dr. Geeta has, by her encouraging only, today it is possible that I have to do this webinar. I am very thankful to Dr. Geeta. Today, though my hospital is in Basavaraj, Sanjeevani Ayur Care Hospital, and my wife's Dr. Savitri, we both are working in as a both were working here. So today my topic is Rakthamokshana. So Rakthamokshana means almost all of you know that it is one of the Panchakarma. Vamana, Virechana, Basti, Nasha, and Rakthamokshana. Acharya Sushruta and Vakpata has given very much importance to the Rakthamokshana. They have considered this as a half of the treatment in Shalya Tantra. So let me first, I am not going to tell you the theoretical aspect regularly, and in brief I will tell you. So there are types of Rakthamokshana. There are two types mainly we do that. One is Shastra Prayoga, another one is Anushastra Prayoga. So it is in order to drain the accumulated blood from a particular point of the body by using Shastra, that is instrument. Here, and in Anushastra, depending upon the doshas, considerable pathogenic factors or diseases causing agent in the body, it is further classified into 4 groups. That is, one is Jaloka Prayoga, second one is Shringa Prayoga, third one is Alabu Prayoga, third one is Yantra Prayoga, that is, we can say Ghati Yantra here we are doing. So in second, again in Shastra Visravana, there are 2 types. One is Prakshana Rakthamokshana and another one is Shiraveda. So next, here we can discuss with some cases briefly. First, whatever Jalokas, the types of Jalokas, shall I explain all these things? Is it necessary?
You can give brief introduction.
So there are 2 types of Jalokas. One is Savisha, another one is Nirvisha. So Savisha and Nirvisha. Here we are using Nirvisha Jalokas. That is Kapila and all these things. There are 4 varieties of the different varieties of Jalokas. So in Nirvisha Jalokas, first of all, what we have to do is, especially in Sharad Ritu, we used to collect the Jalokas. That is called as Nirvisha Jalokas. We put it in a mud pot. With daily we change the water. So we require to change the water, fresh water only. So regularly, daily we have to change the water. And before going to do that, there are previously Purva Karma, Pradhana Karma, and Pashat Karma. These are the 3 methods what we follow according to the purification of the Jalokas. So in Purva Karma, we used to put the Jalokas in fresh water and we add turmeric powder, that is Haridra Churna, that we mix with water, that will become Haridra Jala. So we will keep it for 10 to 15 minutes to purify the Jaloka. That is called as Jaloka Shodhana. Now we will select the patient according to the capacity. Kushta, Visarpa, Kaksha, Arbuda, and Shofa, Vidhradi, Mukhadushika, whatever the diseases, first the criteria is to select the diseases. According to classical, we have to do this Jalokacharana Chikitsa. So after 15 minutes or 10 minutes, we remove the Jalokas from the Haridra Jala and we will put it in a fresh water for another 5 minutes. So it will become refreshed. Again, when you start put the jalakas in the Haridra Jala, it start craving. So after that, when we feel that now it has become fully vomited everything, now it has become clean and now it is ready to use, again we will keep it in a fresh water for another 5 to 10 minutes. Now the jalakas are ready to use. So only Nirvisha jalakas. So why we are using jalakas in almost all cases, maximum in the 90% cases we are using jalakas, because Bhiru peoples, Raja peoples, those who were afraid of nature, those who were weak, for them we are using jalakas. And mainly regarding jalakas, so many research works we have seen. 99% what people say that in the modern people also, now they were using Jalokacharana in their cosmetic surgeries and plastic surgeries. They were using the Jalokacharana, and we are having the history from the Vedas only. In Dhanvantari hand, he is having the Jaloka, Shankha, Chakra, and Jaloka, Amrutaghata in his having in his hand. That's why we has giving. And one thing that everyone says that Jaloka is an insect, but I won't say that Jaloka is a god. Jaloka is a god for the mankind, that which is treating for the mankind. That's why we pray always whenever we do the treatments. First of all, the prabhava of that, without prayer we should not start. That is my personal opinion. So next, let me start a few cases which have got a very encouraging results. First of all, I will start about Vrana Chopa. The Vrana Chopa is the symptoms. Almost all you might have been studied in Sushruta Sutrasthana, 17th chapter, 3rd shloka. Chopa Samuttana Granthi Viryadalajipa Pravutaya Prayena Vyadhayobheta Aneka Krutaya Tair Vilakshana Pratagartita Samo Vishamo Va Twang Mausasti Dosha Sangata Sharireka Dosha Stita Shopa Ituchate. This is the Sushruta Sutrasthana, 17th chapter, the 3rd shloka. Vrana is widespread, nodular, regular, or irregular, is due to accumulation of vitiated doshas in the skin, muscle, and may anywhere in the part of the bodies. Now, after almost all, when we go to the different diagnostic aspects, cellulitis, thrombophlebitis, varicose vein, we will see all these lakshanas. So why in Shopa, Vrana Chopa, how we have planned for this Jalokacharana Chikitsa? Here the treatment where Acharya Sushruta has given that Vedanopachamanaarthaya tatha pakachamaya cha achirotpattete shope kuryat shonita mokshanam. Here clearly has mentioned, achirotpatite shope kuryat shonita mokshanam. Sa shope katine dhyame sa rakte vedanavati samrabdo vishame chapi vrune vishravanam hitam sa vishecha visheshena Jalokabhi padastataha. Yes, he has clearly mentioned here the word Jaloka. So Sushruta, after considering all the doshas, from where the doshita rakta has to be drained. So here Shonita Mokshana and Jaloka, both he has given the references. And according to Vakbhatacharya, he has given Shofe Vrnecha Katine Vivarane Vedananvite Vishayukte Visheshena Jalokad Haridasro Dusta Prapayavate Sadya Shofa Ragaruja Shamam. So this only word here I want to highlight. Dustasrup Apagate Sadya Shofa Raga Ruja Shamam. Sadya Raga Ruja Shamam. This is the only word from Ashtanga Hridaya. It gives us a lot of experience to treat the patients. Sadya Raga Ruja Shamana. Shofa. Whatever it may be. If you do the Rakthamokshana, sudden result you will get. It's 100%. And my practical aspect, whenever I have seen that that after doing the Rakthamokshana, patient has got immediate result I have seen. So regarding that one case, I want to tell you that apart from this subject, one patient has got appendicitis. With his reports he came, and the doctor at midnight, 11 o'clock, he told that you have to operate for the appendicitis. Otherwise, it will cause a death to the patient. So patient from there, the patient is from Gulbarga, and immediately my friend, he called me, sir, one case is there, appendicitis, and he is admitted in the hospital. Tomorrow morning, now they told that within 12 hours, they have to operate it. It's an emergency case. How to handle? Then I told it, well, now what is the condition right now? The pain is severe pain, sir. McBurn pain, severe pain is there. So let him operate only. And his father, he was very much interested in the Ayurvedic system. So after consulting an Ayurvedic physician, he is also my friend, and he called me, and I told him that just right now you can manage with the pain for a minimum 4 to 3 hours, 3 to 4 hours. Just you can maintain with an IV line or whatever it may be, and you can send to a patient to us. So immediately he has given some IV lines and antispasmodic drugs, and that after that he is referred to me. So the patient came in the early morning at 6:30 to Basavakalan. So immediately I did Shira with the Rakthamokshana. Immediately from a right cubital fossa, approximately I removed 100 or 150 ml of the blood. Immediately the patient, what happens means, suddenly patient told that now there is no pain. So he slept for 2-3 hours comfortably. And after that, when I examined, there is no tenderness, nothing, no vomiting. Patient is completely comfortable. And I asked him, just you can have the breakfast and I will do another treatment. So I came to my house and I have become fresh. And later on I went again clinic. Then I asked the patient whether he have taken the food. Told that, no, sir, I won't take. Now I am not feeling the hungry. So what to do next? Then he's sleeping. And at the exact McBurn point, I applied 2 Jalokas. Later on, I told him that you can have the food, you can have the breakfast, whatever. If you want, you can eat. Still evening, the patient has not taken a single drop of water. And I asked him, you can have the food. And then it told, no, sir, doctor told me that nil by mouth only. If anything wrong happens, suddenly, if the circumstances, if it comes, I have to be an operate, then I should be nil by mouth. Till evening, 6 o'clock, he has not taken a single drop of water. Even though after Rakthamokshana, the patient is not feeling hungry and he is not that much of seriousness is not having. And I told him that you can go to your house. Then, no, sir, no, I won't go. Today I will stay here only. I told that I advised him, don't worry, nothing will happen. No need of surgery. Again, you can take 3 days or 4 days medicines, and later on we will confirm that. We'll do one more scanning, whether what type of result we will find. So the patient night stayed with me only. That much of operate, and his family members also told, no, sir, we won't go to house. Today we'll stay with you only. Whatever if the problem comes, whatever the next advice you give, that only we follow. So tomorrow morning, and I told him that nothing to worry. Now you can have the, at least some little bit food. You can take whatever it may be. Otherwise, you can have the liquid diet only. So the patient has taken ganji and something, and he slept full night comfortably. And morning, they went to their house, Gulbarga. And after 3rd day, I told him that, how is the pain? He told, no pain, no vomiting, nothing, sir. Now I am passing, the stool is comfortable, my appetite is normal, I am eating. So after 3rd day, again I told that, with my prescription only, with my referral letter only, you have to go to the radiologist and you have to go for a scan. After that USG has done, in that USG, it was clear that there is no appendicitis. Then I believed that Sadhya Raga Ruja Shamana is the Ashtanga, what the Acharya has given. It is 100% scientifically proved one. then I say that Rakthamokshana is the half of the treatment. Why Acharya is given? That came into my mind, and that day onwards, I thought that now whatever it may be, we can cure the diseases by Rakthamokshanas, and that has given me an encouraging that sloka. What I said always, I used to say that Dushtashraya Pagate Sadhya Shofa Raga Ruja Shamam. That is excellent word that Acharya has given us. This is the boon for the Ayurvedic physician. So after that, after 1 month, he came to the follow-up. Again, after 1 month, we did the USG. That was normal. And that patient, in a single day, he has gone for 3 radiologists. Without my knowledge, with 3 radiologists, he's consulted and he's done the check, what you can say, that cross-checking radiologist, and he is very happy. And still today, he told that more than, I think that is 10 to 14 years history. Till whenever he comes and meets me and says, no sir, no pain, nothing, I am perfectly all right. Next slide, please. So next slide. Next slide. Next slide. Yes. This is a Vrunashopa patient, and this patient is a 55 years male. So he was very much interested in Ayurvedic. He's a one of my family friends, close friend. He came that you can seeing that severe, what you can say, the redness of the leg, itching, and there the pustules. So he told that immediately he came to me only. 1 day or 2 days he has taken the painkillers and he has never consulted any doctors. Immediately he came because previously he was referred one patient to me. He was a scientist. He has got the cellulitis. So he was admitted for more than 1 month in the hospital. That was not cured. And it was sent to me. And after that, within 15 days, he recovered. So by seeing his only, he came to me with his result. Now we can see that first you can see, second, next slide please. So here we applied 4 jalokas. Are you seeing, Gita?
Yes.
Yeah. So it's the first sitting of Jaloka Charana. Immediately the patient is having fever, chills, everything has subsided. That was amazing. You can't believe that. And in few cases also, I have seen that after applying Jalokas, some patients have got rigors and chills also. That also we manage with Rakthamokshana only. So see that after this is first sitting, second sitting, and third sitting, you can see the result, and he's very happy. And he told that, sir, now I am all right. This is the result. This case 1, you can see that there is totally the patient has got 100% result, and you can see the result here. Now, next slide. This is the one more case. This patient came from this lady. She came from Alan Taluka. She is also from Gulbarga district. She has given the history. She is about 52 years old lady. Sir, I don't know what happened. Something has bitten me. I don't know what has bitten me. Whether scorpion, snake, what, she is never taken as a serious. And later on, it has become totally swollen. The whole thing, swelling, you can notice here. And later on, she was admitted in a hospital, super specialty hospital, and they have treated with analgesics, antibiotics, everything. Again, the condition has worsened. Again, the swelling has increased. Even though after antibiotics and all these things and anti-inflammatory drugs also, it has worsened the conditions, and she is unable to wear the blouse also. That much of swelling came in the total wrist and hands totally. And someone has given the same where she was treating, when doctors advised surgery, so she came to me directly, Basavakalan. And second, you can see that necrust, everything part, it has totally full of pus and foul smell. Next slide. So here we applied 3 to 4 jalokas at a time. And after 4th day, again we did it. And here I have taken as an option for this to heal the Runaropana Chikitsa. I have done Dhupana Chikitsa for this. A Dhupana with Panchatikta Gugula Grata. Dhupana, I added Haridra and Tripla Gugulu. And from that, we have given the Dhupa. But that video I have missed here. I could have been shown that video also. So after third sitting, in the sense, after finishing 1 month of the treatment, regularly, I told that she used to come from Gulbarga, regularly Aland. So after third sitting, so next slide. So you can see that 90% wound healed. 90% of the wound healed. And after that, I have lost my mobile. There where I saved all my data. But because I'm very poor in this electronic things. So again, when Dr. Gita told me, if any interesting case, you can give me the complete picture. This luckily I got this lady's number with me, and I called her and told that you have cured your hand, and will you send me the photo? She told that I am in the field. Whenever I will come to my house with my son, I will send this photo. She clicked in her house only, and she has sent this pic. So this 100% result you can see with this Jalokacharana Rakthamokshana Chikitsa. So complete cure, we can say, no reoccurrence. And after 5 years, she came with her husband only for the same problem. I am not having her husband photographs. Next case, the case here, this you can see that Vrunachopa. This patient went to Chardham Yatra. While returning from train, he get down in Hyderabad somewhere, and while taking bath, he's noticed that something has pinched. I don't know what has bitten. He don't know. Suddenly, it has become swollen. Swelling has noticed, and at the evening time, he has got complete 102-degree fever, high grade fever. In such a high grade fever, he came to his house, his native place, and he has taken 1 or 2 days treatment with the local doctors. Again, the condition has worsened. After that, directly he came to me and he called me. Now, here you can see that more than 8 jalokas I applied. More than 8 jalokas I have applied. After that, he told that the swelling you can't imagine. The previous photo I am not having the swelling. Later on, after applying the Jalokacharana, he slept whole night comfortably. First sitting of Jalokacharana, now I am feeling comfortable. Next slide, please. Now you can see here. Next slide. So after that, you can see that the pus which is accumulated inside, I tried that. After that, I have done a Prachana Rakthamokshana here. And when I started that, applied the cup, you can see the pus. 3 cups of pus I have removed. More than 3 cups. First day, after that Jalokacharana, second day, I have removed more than 3 cups of pus. Later on, again, I have continued that Runaropana Chikitsa. And for this also, I did the Dhupana Chikitsa with the same thing, Panchatikta Gulu, Haridra, and Triphala Grita. And in a week, twice I have applied Jalokas. More than 8 Jalokas, and sometimes I applied 8 to 10 Jalokas also. After 4th sitting, now you can see the result. This is the, I should not use the word miracle, because when I used a miracle, one senior most professor has called me, what nonsense you are talking, it is a miracle. It is a scientific study. It is a scientific one. It is not the Jadu Tona. Why are you using this miracle word? So I can that the scientific way how we have treated, and you can see the result. This patient now still 3 years is not having any problem and is not taking any medicines for this. Only he is on completely Ayurvedic treatment. Whenever, even if he gets fever, then also he will call me and he will take the medicine. This is the case. Now, next slide. This case is very, very interesting one. You can see that totally up to the knee level. You can see this is a known case of diabetic mellitus, hypertension, this case. So here, this patient was admitted in a super specialty hospital, Hyderabad. There, they have done this patient done venous Doppler test. So after venous Doppler test, it was finding that no DVT in both sides, decreased flow and velocity is noted both sides, subcutaneous edema noted in left lower limb up to the level of knee joint, cellulitis changes left lower limb. So the doctor advised MR and CT venogram for better evaluation, and they have done the culture wound swab for culture and sensitivity tests, and no bacterial growth in culture after 48 hours in aerobic infection that we have noticed, and they have did 2D echo and all these things, and the doctor has told that immediately you have to undergo surgery. The patient has become upright. He's a poor and not affordable condition, and they have told him that fees and everything is high, and even they have told that if necessity, the condition will come that amputation is necessary. Then after the name, when he heard this word amputation, he called to his some relatives nearest to the Bidar, and he is from Bidar only, Bidar district, and he is my close friend's father-in-law. My close friend's father-in-law, and he called me. If the condition is like that, is there any chance to avoid surgery? Then I told that without seeing, how can I say? And he posted me all the reports. And the next day, I told him that with clean washing, you can come with to me. The immediately when he came, I started the gel operation. Next slide, please. So you can see 1 minute before. Yes, you can see that. One more before. Yes, this you can see completely necrosed. Next slide, please. So you can see here, pus, foul smell, everything was present. Sepsis, totally sepsis. And what you can say that the threatened limb, whatever cellulitis with sepsis. Next slide. So immediately I applied 6 Jalocas. Immediately, without considering everything. So even I have not taken the consent of the patient because he's my friend's father-in-law only. So I explained him the high risk also. So whatever it may be, then again further you have to do. After that, next slide, please. So next slide. So after it is 4th sitting, after 1.5 months, you can see that the result. Only after 1.5 months only, it has cured completely. Everything is normal. Now, I told him that you can go for another MR incident. अरे डॉक्टर साहब छोड़ दो, सब क्या करने का है, बस मुझे चलने को आ रहा है, मुझे कोई तकलीफ नहीं है, आई एम परफेक्टली ऑलराइट. आपको कोई भी अगर बोलेगा ना, आप पैसे लूटने के लिए कर रहे हो सभी इन्वेस्टिगेशंस. तो मैं बोला भाई मेरे पास तो इन्वेस्टिगेशन करने का नहीं है, आपको अगर चाहे तो आप बाहर के हॉस्पिटल में, अगर हैदराबाद का नाम मत लो. बोला साहब हैदराबाद का नाम मत ले लो, बट आई एम ऑल राइट. एंड आफ्टर 5 years ही मेट मी विथ दिस कंडीशन ओनली. सर मैं बहुत अच्छा हूं, अब मेरा सारा काम कर रहा हूं. दिस इज द रेमेडी व्हाट वी फाउंड इन आयुर्वेदा बाय Rakthamokshana. This second case result you might have been seen. Now next slide. So this is also same case. Again we applied 4 to 5 Jalocas, the intervals of 1 week. Next slide. Next slide, please. This is the result. So this type of cases we have done. Next one, very interesting. That everyone doctor said that डॉक्टर साहब पहले आपके पास आना था हमें. This word I have heard. This is the case of gangrene. Yes. Next slide. Yes, this is the case of gangrene where they have amputated all the 4 fingers. You can see here. Itna, the patient is to say that even his family members say, sir, ರಾತ್ರಿ ಮಲ್ಕೊಳಕ್ಕಾಗಲ್ಲ, ನಮ್ಗೆ ಊಟ ಹೋಗಲ್ಲ, ಏನೂ ಅಲ್ಲ, ಅಷ್ಟು ಹೊಲಸು ವಾಸನೆ ಬರ್ತದ್ರಿ ಇದ್ರಾಗಿಂದು. ಇದು ಪಸ್ ನೋಡಿದ್ರೆ ನೀವಂತೂ ಎರಡೆರಡು ಮೂರ್ ಏನ್ ಕಟ್ತೀವಿ ಅಂತ ನಾವು ಮನೆಗಿಂದ ಖೌದಿ ಕಟ್ತೀವ್ರಿ ಅಂತ. ಖೌದಿ ಮೀನ್ಸ್ ಬ್ಲಾಂಕೆಟ್, ವಾಟ್ ಯು ಸೇ ಇನ್ ಅವರ್ ಉತ್ತರ ಕನ್ನಡ ಇನ್ ಅವರ್ ಬೀದರ್ ಡಿಸ್ಟ್ರಿಕ್ಟ್ ವಿ ಯೂಸ್ ಟು ಸೇ. ಅದೆಲ್ಲ ಕಟ್ಟಿದ್ರು ಕೂಡ ಇದ್ರಾಗಿಂದ ಒಳಗಿಂದ ಅಷ್ಟು ಸೋರ್ತದ್ರಿ ಹೊಲಸ. Even my compounder, when he started taking the clip, she has fainted. Sir, ನಂಗೆ ಚಕ್ಕರ್ ಹೊಂಟಿದ್ರಿ, ನಾನು ನೋಡಲ್ರಿ, ನಾವು ಅಲ್ರಿ ಅಂತ. See, this much of worsened conditions he came, and the patient is even not even affordable condition also. That they have told that amputate these 4 fingers, and later on that wound is not healing, totally not healing. And next slide, you can say that he came with me. After that, we applied 4 to 5 jalokas every week intervals. After that, even also I did dhupana chikitsa and unaropana chikitsa also, prakshalana with panchavalkala kvata and triphala kvata, and I have added here jatyadi taila plus arimedadi taila and plus honey. In this case, the combination what I have made it, and I thought that combination of honey, why? Because I made once again the cells growth will be take immediately, and you should avoid it. When the doctor advised the amputation below the ankle, now you can see the result. It was completely healed from back side and front side. Next slide, please. You can see that this is the result. This is, I can say that the patient told, डॉक्टर साहब अगर पहले ही पता होता तो मेरे 4 उंगलियां भी बचते थे, अभी तो मेरा पैर काटने वाला था, लकीली आप मुझे मिल गया, ये मेरा पैर बच गया. Now after up to 10-15 years he is on only for diabetes also, he is taking Ayurvedic medicines. Insulin has completely stopped. And next patient, this is also a gangrene case where you can see that one finger has amputated. You can see after time, you can see that one finger has amputated. Total blackish discoloration. Doctor is doing dressing daily in a super specialty hospital. Since 6 months to 8 months, the wound is not healing. Again, total it has become totally blackish discoloration, and doctor advised amputation again below the ankle. And one more, my friend, he has given the address and he came to me. So immediately I applied this Jaloka Charana Chikitsa. You can see that more than 4 to 5 Jalokas I applied every weekly, and Runa Ropana Chikitsa, and along with Dhupana Chikitsa I did. Next slide, please. See, this is the second. After that, after 15 days, that wound is started healing, and after that, you can see, for because of inconvenience, I have not put all the slides here every week. Otherwise, I could have been put all slides here. So ultimately, after 1.5 months, only 1.5 months, you can see the result. It has completely cured. And he told that, Dr. Saab, my madam ka bahut aabhari hu. The madam has done dressing daily only, and this credit goes to Dr. Savitri only. And yesterday only he came and met me, yesterday only. But the patient is very, sir, nandalla kaal chaloda na mat naali ಬಂದು ನೀವು ಭೇಟಿ ಆಯ್ತೇನ್ರಿ. He has given that much of with great confidence, and he came, and nothing, whatever it may be, the fees what if they were giving, that is not the, I don't mind it here. Kochit dharma, kochit artha, kochit maitri, kochit kriya abhyaseva chikitsa nasti nishphalam. That the blessings that will help us definitely, and this result I am very happy. This, and by Ayurveda we can treat such conditions without you can do the daring. 100% we are going to cure the disease. Now next case, this is the gangrene of, you can say that, and he went to doctor, and doctor told that your finger has to be amputated. No doubt, patient again the name by hearing the amputation, and he is a washerman, as a very poor, and he resides beside our house only. So his wife came, sir, doctor hinga ತೋರ್ಸ್ಕೊಂಡಿದೇವ್ರಿ, ಬೆರಳು ಕಟ್ ಮಾಡ್ಬೇಕಂತ ಹೇಳ್ಯಾರ, ಆ ಬೆರಳು ತೆಗಿಬೇಕಂತ ಹೇಳ್ಯಾರ ಡಾಕ್ಟರ್. ಮತ್ತೆ ಹೆಂಗ್ರಿ ನೋಡ್ರಿ ಕರ್ಕೊಂಬಮ್ಮ ಏನಾಗ್ತದೆ ನೋಡೋಣ ಅಂತ ವಿಲ್ ಸೀ ದಟ್. So after that he came and I started Jalokacharana and Dhupana Chikitsa. And next slide please. You can see that necrospores completely came out, and that video I'm not having here, otherwise I would have been Dr. Gita has given me 1.5 hour time only for. That's why I'm telling you that this case you can see the result, and ultimately we saved the finger, we saved the foot. This is what we can say the Rakthamokshana can be considered as half of the treatment. By Rakthamokshana we can treat. And this case again I am showing you, this is also a diabetic foot. This what happens when she came first, she has been cured completely, and once what she had done, she putted her foot to clean the drainage. There one glass piece, it pricked her. Later on she has developed this much of this. After curing all things that pricked, and she has not taken the care, and again after 1.5 months she came, even though we survived her foot, leg, everything. Next slide please. So the wound has healed, but here by only we have removed the finger. Now next slide please. Okay, now come to the Raaaous, your theme, Arbuda. Whenever we can say that Arbuda is coming, and everyone sees that by name hurting the cancer only, the patient will die half. Here a case, you can't believe that he's a just 16 years boy. So I am not going to give the theoretical. Shall I give the theoretical hospital? Is not necessary, no? Regarding Arbuda and all these things? No necessary. Okay. So here, why I selected treatment of Rakthamokshana, that symptoms and all these things I will tell you later on. Vataja Arbuda. Vataja Arbuda is how we have to treat. Svedam vidadyat kushalastu nadya shrungena raktam bahusho harechya. See that Acharya Sushruta has given clear cut Sushruta in his Chikitsasana 18th chapter 31 shloka. I can see that Svedam vidadyat kushalastu nadya shrungena raktam bahusho harechya. Shrungena raktam, you have to do Rakta Vishramana by Shrunga in Vataja Arbuda. And in same Pittaja Arbuda, Shvedopanaha Mruduvastu Karya Pittabudi Kaya Virechanam Cha Vigrishya Cho Udumbara Shaka Gojuva Patraya Bisham Shodra Yute Pralipate Slakshni Krute Sarjarasa Priyangu Patanga Rodra Astika Che Visravya Charagvada Gojo. See here, Visravya, the word he has clearly mentioned in Pittaja Arbuja. You have to do Rakthamokshana in Arbuda. And next, Kafaja Arbuda. Shuddhasya Janto Kafojo with Rakta Vashicito to Tatorbudam Ta. Here also in Kafaja Arbuda, Raktavaseshana he has clearly mentioned. And Medaja Arbuda. Medo Arbudam Svinnamato Vidarya Vishoshodya Sived Rakta Manshu. See here, in Arbuda he has given that much of importance to this case. And here this case what I am presenting, it will give us a prize. It will give us a Nobel Prize. Like that I can say that. You can see that this is the mediastinal fibromatosis case. Next slide please. So this is a 16 years boy. He is studying in the PUC. So you can see the mass here. You can see that mass, mediastinal fibromatosis. It has been considered SVC compression, and he has consulted and cardiologist. He went to the cardiologist and they have done the surgery. You can see the mark here. You can see the mark After this much they have done, then told that no, he is not going to survive. Then the report came. That report is of lipoma and lymphoma and thymoma. After that, he went to Tata Memorial Hospital, Mumbai. After entering the Tata Memorial Hospital, Mumbai, again they have done almost all investigations, everything, and later on, the doctors said, no, this guy is not going to survive for more than 1.5 months. Only one son, you can imagine, after hearing the word he's going to survive only 1.5 months, his father started crying and her family becomes well. And they returned to Gulbarga. And his father told me that the real incident, how this patient has come to me. It's a big story. Here is a one saint, one Mahaswamiji is there, Sri Harakudu Channagiri Shivacharya Swamiji, and he is the best Paramashikha. Their family members, they went to this Swamiji and told that, Appaji, we went to Bombay and doctor ನನ್ಗೆ ಹೇಳ್ಯಾರ ನಮ್ಮ ಮಗ 1 ತಿಂಗಳ ತನ 1.5 ತಿಂಗಳು ಅಷ್ಟ್ರಾಗ ಸತ್ ಹೋಗ್ತಾನ ಅಂತ ಹೇಳ್ಯಾರ್ರಿ, ಹೆಂಗ್ ಮಾಡ್ರಿ ಅಪ್ಪೋರೆ ಅಂತ ಹೇಳಿ they asked, and they have given my address. Just ಇಲ್ಲಿ ಆಯುರ್ವೇದಿಕ್ ಟ್ರೀಟ್ಮೆಂಟ್ ಕೊಡ್ತಾರ ಡಾಕ್ಟರ್ ಬಸವರಾಜ್ ಸ್ವಾಮಿ ಅವರು, you can consult him ಹೇಳಿದಾಗ his father came with all reports and he entered my hospital. And he went back. Suddenly ಹಾಸ್ಪಿಟಲ್ ಬಂದ್ರು, ನಂದು ಚೇಂಬರ್ದಾಗ ಒಳಗೆ ಏನಕ್ಕೆ ಹಾಕಿದ್ರು, 1 ಸ್ಟೆಪ್ ಒಳಗಿಟ್ಟು ಸಡನ್ಲಿ ಹೊರಗೆ ಹೋದ್ರು. ಹೊರಗೆ ಹೋಗಿ ಮತ್ತೆ 1 ಅವರ್ ಬಿಟ್ಟು ಬಂದ್ರು. 1 ಅವರ್ ಬಿಟ್ಟು ಬಂದು ದೇ ಆಸ್ಕ್ಡ್ ಮೀ, ಸರ್ ದಯವಿಟ್ಟು ತಪ್ಪು ತಿಳ್ಕೊಬೇಡ್ರಿ, ನಾನು ನಮ್ಮ ಮಗನ್ ತೋರ್ಸೋ ಸಲುವಾಗಿ ಬಂದಿದ್ದೆ ನಿಮ್ಮ ಹಾಸ್ಪಿಟಲ್ಕ. ನಾ ಏನಿಲ್ಲ ಅಂದ್ರೂ ಕೂಡ ಐ ಹ್ಯಾವ್ ಎಕ್ಸ್ಪೆಂಡೆಡ್ more than 1 crore rupees. ಸೊ ನಂಗ ಟಾಟಾ ಮೆಮೋರಿಯಲ್ ಹಾಸ್ಪಿಟಲ್ದಾಗ ಹಿಂಗ್ ಹೇಳಿರು, ಅಪ್ಪವ್ರ ನಿಮ್ಮ ನಂಬರ್ ಕೊಟ್ಟರು ನನ್ಗ, ನಿಮ್ ಕಾಂಟ್ಯಾಕ್ಟ್ ಮಾಡಂತ ಹೇಳಿದ್ರು, ನಾ ಬಂದಿದ್ದ. ಬಟ್ ಬೈ ಸೀಯಿಂಗ್ ಆಲ್ ಯುವರ್ ಸೆಟಪ್, ನಿಮ್ದೇನ್ ಸಣ್ಣ ದವಾಖಾನಿ ರೀ, ಅದಕ್ಕ ಸಾರಿ ತಪ್ಪು ತಿಳ್ಕೊಬೇಡ್ರಿ, ಮತ್ತ ನಾ ನಿಮ್ಗೆ ಹೇಳಿ ಹೋಗಾರೆ ಅಂತ ಹೇಳಿ ಬಂದೀನಿ ಅಂತ ಹೇಳಿ he went back and again tomorrow he came. The next day he came to me and he told that, ಸರ್ ಮತ್ತಾನು ರಾತ್ರಿ ಅಪ್ಪವ್ರು ನನಗೆ ಫೋನ್ ಮಾಡಿ ಹೇಳಿದ್ರು, ಇಲ್ಲ ನೀವು ಹೋಗಿ ಅವ್ರಿಗೆ ಭೇಟಿ ಮಾಡಿ ಟ್ರೀಟ್ಮೆಂಟ್ ತಗೊಳ್ಳೇಬೇಕಂತ ಹೇಳ್ಯಾರಿ ಅಂತಂದ್ರೆ. ಬಟ್ ನನ್ನ ಮಗ 1.5 ತಿಂಗಳದ ಸಾಯ್ತಾನ, ಬಟ್ ನಿಮ್ದಿಂದ ಏನಾರ ಸೈಡ್ ಎಫೆಕ್ಟ್ ಆಗಿ 1 ತಿಂಗಳದ ಸಾಯ್ಬಾರ್ದ್ರಿ ಅಂತ. I told that when the doctor, the super specialty hospital, they have given the deadline of 100, then what can I do? So please excuse me, I told them. ಇಲ್ಲ ಅಂತ ಹೇಳಿ ಅಗೇನ್ ಅವನು ಹೇಳ್ದ, ಇಲ್ಲ ಸರ್ ನಂಗೆ ಟ್ರೀಟ್ಮೆಂಟ್ ಕೊಡೋದೇ ಬೇಡ್ರಿ, ನಾನು ಹೋಗ್ತೀನಿ ಮನೆಗೆ ಅಂತ ಹೇಳಿ. ಅಗೇನ್ he went back. Again third day he came and Swamiji phoned me, ಬಸವರಾಜ್ ನೀವು ಆ ಪೇಷಂಟ್ ಯಾಕೆ ನೋಡಿಲ್ಲ ಅಂತಲ್ಲ ಅಂತ. ನಂದ ಅಪ್ಪರೇ ಆ ಪೇಷಂಟಿಗೆ ನಮ್ಮ ಮ್ಯಾಗನು ವಿಶ್ವಾಸ ಇಲ್ಲ, ನಮ್ಮ ಸಿಸ್ಟಮ್ ಮ್ಯಾಗನು ವಿಶ್ವಾಸ ಇಲ್ಲ. ಅಂಡ್ ಆಲ್ಮೋಸ್ಟ್ ಆಲ್ ಅವ ದೊಡ್ಡ ಹಾಸ್ಪಿಟಲ್ ನೋಡ್ ಬಂದ ನಾವ ಎಲ್ಲ, ಅದಕ್ಕೆ ನಮ್ ಸಣ್ಣ ಹಾಸ್ಪಿಟಲ್ ಏನೂ ಆಗಿಲ್ಲ. ಅಂಡ್ ದೇ ಫೋರ್ಸ್ಡ್ ಹಿಮ್ ಟು ಟೇಕ್ ದ ಟ್ರೀಟ್ಮೆಂಟ್ ವಾಟ್ ಎವರ್ ಇಟ್ ಮೇ ಬಿ, ಅಂಡ್ ವಿತ್ ರಿಟರ್ನ್ ಕಾನ್ಸೆಪ್ಟ್ ಐ ಹ್ಯಾವ್ ಟೇಕನ್. ಅಂಡ್ ಒನ್ ಮೋರ್ ಮೈ ಫ್ರೆಂಡ್ ಈಸ್ ಟು ಸ್ಟೇ ವಿತ್ ದೆಮ್ ಅಂಡ್ ಹಿ ಟೋಲ್ಡ್ ದಟ್, ಸರ್ ಇಲ್ರಿ ನೀವು ಸರ್ ಬಲ್ ಹೋಗ್ರಿ, ನೀವು ಹೆಂಗ್ ನಾವು ಟ್ರೀಟ್ಮೆಂಟ್ ಆಗ್ತದ 100% ಆಗ್ತದ. ಅಪ್ಪವ್ರು ಹೇಳಿಲ್ಲ ಅಂತಂದ್ರೆ ನೀವು ಇಲ್ಲಿ ಬಿಟ್ಟು ಬೇರೆ ಕಡೆ ನೀವು ಹೋಗ್ಲಕ್ಕೆ ಹೋಗ್ಬೇಡ್ರಿ, ಅದು 1 ತಿಂಗಳು ಏನಕ್ಕೆ ಆಗಲ್ದು, 1 ತಿಂಗಳದ ಸಾಯ 1.5 ತಿಂಗಳದ ಸಾಯ ಸತ್ರೇನು 8 ದಿನ ಸತ್ರೇನು, ಬಟ್ ಸಾಯದಂತೂ ಡೆಡ್ ಲೈನ್ ಫಿಕ್ಸ್ ಇದ್ಮ್ಯಾಕ ವೈ ಯು ಆರ್ ಬಾದರಿಂಗ್, ನೀವು ಧೈರ್ಯ ಗಟ್ಟಿ ಮಾಡಿ ಟ್ರೀಟ್ಮೆಂಟ್ ಚಾಲೂ ಮಾಡ್ರಿ ಅಂತ ಹೇಳಿ he told. Later on the patient came and I told him, whatever it may be, I am not responsible. If he dies, I am not the responsible. You have to give high risk consent. Then I have taken the high risk consent and he has done the signature. You can see that such hard, a big mask up to the left, but he never used to wear this collar and button. It was totally such a big mask. After first only I applied only 1 jalaka with fear that if something wrong happens, I will be culprated. I am the criminal for this case. So I thought that slow and steady wins the race. First I applied the leech, 1 single leech, and I told them after 1 week you came. Again he came. Again I applied only 1 leech only. I seen that now it is becoming soft. After that I started applying 3-4 leeches. After 1.5 months, the deadline came. The whole night I have not slept. Within 1.5 he is going to die. Tomorrow what happens? What type of craze it will go? What may the situation will take the turn? I don't know. So whole night I have not slept. And morning he came after 1.5 months. Then I breathed freely. By seeing is that, sir, ನಾನು 50% ಕಡಿಮೆ ಅನಿಸ್ಲತ್ತದ್ರಿ. He told that, sir, ನಾನು 50% ಕಡಿಮೆ ಅನಿಸ್ಲತ್ತದ್ರಿ. I am very happy with this treatment. Then I told that your period has been completed. 1.5 months it has gone. Now you are out of danger. Now psychologically I have prepared him. I told them nothing will happen. Within 1.5 months it will go completely, to vanish completely. Then I have applied 4, 5, 6 like Jalapas every week. Every week more than 30 to 40 times I have applied the Jalapas. Without afraid, without hesitation, I applied 4 to 6 every week. So more than 30 sittings, more than 30 sittings. Now you can see that. Next slide, please. Next slide. Next slide. You can see the result. Completely cured. And the doctor, up to 1 year I have treated. Then that I should not tell everything detail. I have not disclosing his identity totally. And even though today I'm not interested to disclose his identity, because Dr. Geeta told that only the Raaaous aim to treat the cancer conditions. So successfully I have treated. He has completed BE. He has completed MTech. Last year only he married. This is the grace of Lord Dhanvantari and Lord Channabasaveshwara. I can say with wholeheartedly. This is the result. You can say he is now completely all right. So this type of cases we have treated successfully by only Rakthamokshana Jalokacharana Chikitsa. Next slide, please. And this is also same case. And next slide, please. You can see this case is a very interesting one. This is also same. This one has diagnosed as lymphoma, germ cell tumor, everything. This is last the true that trichite biopsy report has came as lymphoma. And doctor told that he is no more. He is not going to survive. Chance nahi. Itna bada swelling, this much high grade fever, chills, everything is. Then he came to me. The first day I told that मेरे हाथ से भी होता नहीं है, क्योंकि पता नहीं क्या होने वाला है, ये तो इतना बड़ा मोटा ये है, तो you can go to सर मुझे तो ऑपरेशन भी करवा लेना नहीं है और मुझे जाना भी नहीं है और मेरे पास पैसा भी नहीं है. मैं थोड़ा देर आई गिवन सम, नहीं वो स्कीम है, ये स्कीम है, उसमें जाके आप कर ले सकते हैं, जाना है तो कर लो. बोला नहीं सर, मेरे को ये पेशेंट बताया, that patient only, that patient what previously I have shown now, he only given his address and he went to cross checking there, and he came and I have treated this one, and luckily I am not having. And even here I did Agni Karma also. You can see the spots of the Agni Karma. Suddenly after doing Agni Karma, the patient has got, sir मेरा दर्द पूरा कम हो गया. Immediately Sharat Agni Garyan. This sloka was given by Shrita. Sharat Agni Garyan. In Sadhya you can see that, and Sadhya Raga Ruja Shaman Rakthamokshana. So the patient slept very well, and 5 to 6 sittings of Jalokacharana I did. Now the patient is completely all right. Next slide, please. Next slide. Yes, this patient, where I can see that a patient is very familiar to me, and his brother lives in Mumbai. His brother lives in Mumbai. When he has diagnosed this is CA, first of all, what we did is we had taken all of this was considered as thyroiditis. Later on, when we started Rakthamokshana Chikitsa and Jalokacharana, he has become completely all right. And he told that, sir, now I can eat. Now I am not having any complaint. Now I am not having any pain. But one his relative person, he came out, hey, huchide no, inta bane itkondo, inta san dawkane torskotini. ನಿಮ್ಮಂತರ ಬೇಕು ರೊಕ್ಕಕ್ಕೆ ನೋಡ್ತೀರಿ ನೀವೆಲ್ಲ. You are thinking of the money. Why don't you go to higher centers? And he taken him to the higher center. After that, you can see that it has happened. In such conditions, again he came to me. That's up is no regular. Then what can I do for this? Later on, to prolong his history, and I have managed with Ayurvedic treatment till 1 year. He survived, but later on, because of this much of infection, and the patient has not again not cooperative, and he has not started taking the medicines and all regular things, and he is collapsed after 1 year. Then that is not the mistake of ours. Then I told that his brother came. That was also a very interesting story.
Please mute the gadgets.
So after that, his brother came. Sir, nam brother nan maat kelilri. Na, because his brother's wife I have treated. She was in Mumbai. When the next slides comes on that particular period, I will explain that case. So after 1.5 years, he expired. So said to sorry, it is not the mistake of Ayurveda. Next slide, please. Next slide. See this case. One more, next slide. You can see Dushta Bruna. You can see that this part totally necrosed the leg. You can see that. See the leg totally necrosed. He is of 95 years old. He is of 95 years of old, and a known case of diabetes, and is having the brain tumor. So when he came to me, and he's my relatives, in relatives only. He used to stay in Nanded, Maharashtra, and he's taken treatment Aurangabad, Nanded, everywhere for brain tumor, fits, everything. And the doctor told that by seeing this, no, he's not going to survive. And we have to remove this skin, and we have to do screen grafting and all these things. It is not possible in this age. So we can't, we are helpless. Then this patient came. You can see here, I have applied 5 to 6 Jalokas. The next day, you can't believe that more than hundreds of maggots. Oh, the maggots, by seeing that, by my staff, she has fainted and giddiness she fallen. That picture we are not, that video I have not done. She suddenly fall. 100 worms to hang antandra, you might have seen hendagin hole antar nam kade. Like that, 100 together started. Even I also became afraid. Arey bapre, what is this? So my hospital, it has become full of maggots. Pura yell nodralli, pura hospital full of maggots only. One start ಮಾಡಿ ಬಿದ್ದು. And I have perfume. I have sprayed the perfume that more than 500-600 rupees perfume to clean my hospital. So later on, you can see next, before previous slide. This you can see, and I have did that what debridement, everything we have removed, and we did a Runaropana Chikitsa with same Jatyadi Taila, Rimeri Taila, and honey we added, and Runaropana Taila we have mixed. And here, especially in Dhupana, I have added Vidangadi Loha. I crushed the tablets of Vidangadi Loha and turmeric, Haridra, and Trifala Gugulu, and Aparajita Dhupa. I have given specially with and added Panchatikta Gugulu Gruta. Next slide, please. Next slide. See the result. Up to 100 years, he lived free from any complications. This is the result we can say. So this type of wonderful results, where we can say that, I can say that here with proud, here I am the neurologist, I am here the plastic surgeon, I am here the cosmetic surgery, whatever it may be, here with Rakthamokshana and Dhupana Chikitsa, we have this case. Next case. Next slide, please. Next slide. Yes, this is also a very interesting case. Just a minute. Just I will tell you that. This case, all the way from Pune. Pune, he came. This case, CT angiography of both lower limbs they have done. The dual CT angiography left lower limb it has done. The sense first the complaint is that tingling sensation, numbness, and blackish discoloration of the skin and wound. So they have diagnosed this case as thromboangiitis obliterans, threatened left limb. This patient, I am not going to give all the radiological aspect here, and they have advised bypass surgery. Doctor has advised bypass surgery. Next slide, please. Next slide. You can see in the report. It is not my report. This is the report of Pune Hospital. The doctor has advised bypass surgery. When the name heard bypass surgery, he is of 35 years old only. Came back to Basavaraj. He lives in Basavaraj only. And he told us, sir, ನಮ್ಮ ಡಾಕ್ಟರ್ ಹಿಂಗೆ ಹೇಳ್ಯಾರ bypass surgery ಮಾಡ್ಕೋಬೇಕಂತ ಹೇಳ್ಯಾರ. ಬಟ್ ಏನಿಲ್ಲ. ಇಲ್ಲ ಅಂದ್ರೆ ಕಾಲ್ ತೆಗಿಬೇಕಾಯ್ತದ್ರಿ ಅಂತ ಹೇಳ್ಯಾರ ನೋಡ್ರಿ ಅಂತ. What is the remedy for that? Then he came to me. Then I told that I will try my level best. I am not going to assure you that I am going to treat 100%, but I will try. Previous slide, please. Previous slide. Previous slide. You can see here. No, next slide. Next slide. No. Yes. Previous one. Previous one. So after when he came to Basavaraj, this much have developed the wounds and all these things. Suddenly I applied leeches. Next slide, please. Next slide. You can see that I applied the leeches. After third sitting of Jalokacharana, there is a change of color in his foot. Blackish coloration, it has turned. Next slide, please. You can see no wound, nothing. Now, this I will give you the date. It was in 18. Now it's a 24. Without any medicines, he is living. And I told him that go for a cross-examination. Again, he goes, no, sir, I don't want any angiography, any Doppler, I don't want. Now I am all right. मुझे पैसा खर्च करने का भी नहीं है, मुझे डॉक्टर के पास दिखाना भी नहीं है. This much of a patient has given the assurance, and that confidence level, it has built up the physician's confidence level also increase. Now, next case. He is the known case of diabetic and very familiar to me. You can notice that he is diabetic, hypertensive, So in this case, you can't believe the swelling. It is just like a horror show. It was just like a horror show. That much of swelling. Even it is after this, you can see here. Now, previous photographies I am not having. I have missed that in my old mobile. So he came there. Dr. Saab, nam mani bajuda. One more senior physician, he was there. Our kalno same hinge agada, nan kalno same hinge agada. Or already they have amputated his leg. Nanu Pune hogini, Punadag no doctor helare, nan kal kadibekanta helare. And I told that give me the reports. Nan reports ella haradodu bandidale. I have not brought anything with me. My daughter has shown me there in hospital, and doctor told me that and then call kadibekantara. First ನಾನು ಕಾಲ್ ಕಡದ ಮಣ್ಣು ಮಾಡೋ ಬದಲಿ ನನಗೆ ಮಣ್ಣು ಮಾಡೋದು ಚಲೋ ನಾ ಬ್ಯಾಡ್ರಿ ಅಂತ ಹೇಳಿ ವಾಪಸ್ ಬಂದಿನ್ರಿ ಸರ್ ಅಂತ ಹೇಳಿ. Then I applied Jalocas. You can see here. Next slide, please. You can see that necrose part, everything, pus, and later on, the pus, you can't believe that. Next slide, please. Here I applied cups. Prathyana Rakthamokshana I did here. Prathyana Rakthamokshana I did. And more than 1 liter pus I drained from this one. Literally, I'm telling you, more than 1 liter of pus I drained. Now, after that, dhupana karma, and regularly I advise him to take dhupana in his house only, and dressing has to come with me, because 1 hour I used to do dressing for this patient. Runa Prakshalana with Tripalakwata, Panchavalkalakwata, and again dhupana, and again I used all the Ropana drugs here, and orally in this case I used Gugulu Tiktakagrita and Runapahari Rasa, Tripala Gugulu, Gandhaka Rasayana, Gugulu Tikta Kashayam, and Manjashtadi Kashayam I used, and you can see after 1.5 months. Next slide, please. Next slide. Next slide, please. Vinit. Vinit. Yes, you can see completely healed, and it is completely healed. It was completely cured. Again, one more slide I am having that I am not presenting right now. After 1.5 months, he has injured by what you can say that knife. After that, again, I did 1.5 month treatment for the same procedure, and the whole legs that was necrosed, and that I will show in the next picture. So this complete treatment we have done by Rakthamokshana, that is Jalokacharana, and Prathyana Rakthamokshana, and Ghatiyantra Prayoga. That what can we do? The cupping also. You can see this is the result. That's completely cured. Now next slide, please. Next slide. And this was one more case. That like same Dushtavruna we have treated with Jalokacharana, as he is also on regular treatment. Now he is continually we are doing. Next slide. Next slide, please. Next slide. Next slide. This is also a varicose ulcer case. He is a now case of alcoholic. He used to drink daily, and this wound is not healing. He has taken treatment in all over the super specialty hospitals, Sholapur, Umarga, Gulbarga, everywhere near to the Gulbarga district. So almost all doctors he has consulted, and he came to Basavaraj by hearing that here doing some different treatments, and now later on we did Jalokacharana treatment. You can see next slide. Next slide. Weekly I used to apply 4 to 5 Jalokas, and he is not following the medicines and all regular things. And later on, next slide please. This is the result after 2 months. Here he has got complete cure. And next, one more case. He is a medical representative. He used to walk regularly. The limb has become totally swollen, and you can see that ulceration, that varicose ulcer. Doppler study, everything is done, and we advised him better, but he has not asked. No, sir, my duty is to walk. Later on, for this patient, again we did Jalokacharana. Next slide, please. After that, we put it in crepe bandage and all these things. Dhupan also we did. Now you can see the result. He has completely cured. It was 5 to no, not 5, not more than 8 years. 8 years back we did. Now he is perfectly all right. Whenever he comes to meet me, and I will take the photos of his leg. This is the recent photo also. There is no his company is all right. He's not having any complaints. Okay. Next, shall I continue, Gita?
Yes, you can.
Okay. Dr. Gita has given permission. Now, Galaganda. Here, I am going to speak about Galaganda. Here, the symptoms are Vata Kafashaiva Gale Pravurde Manne to Samsrutya Tatheva Meda Kurvanti Gandam Kramasha Salinge Samanvitam Galagandamahu. This is Sushruta Nidanasthana. Here he has given that Nibaddaha Shvayaturasa Mushkavalambate Gale Mahan Va Yadi Va Vrusvo Galaganda Tamadishet. This is the symptoms he has given. Now, the treatment, why I have taken here Rakthamokshana. In Sushruta Chikitsasthana, he has given that Amlay Samutray Vividai Payobhirushne Sataile Pishitesha Vidwan Visravaye Svinna Matandrisha Shuddham Murnam Chapum Upanaha. See here that Visravaye. Here he has also given that Rakthamokshana we have to do. Next, in Sushruta Chikitsasthana, in the 48th shloka he said, Svedopanahe Kapa Sambhavantu Samsvede Vishravana Meva Kuryat. Vishravana Meva Kuryat. He has given the reference. Next also he has given that Meda Samuttetu Yathopadishtam Vidyate Siram Snidnata Tanorasya. Here also he has given that Shiraveda we have to do Rakthamokshana. Yavad Mudga Patolani Katu Rukshamancha Bhojanam Charddi Saraktamokshijam Galagande Prayojayat. Here Chakradatta has given that. Here we have to do Vamana Karma and Rakthamokshana. He has given the reference. Now you can see the case. Next slide please. See here, this is the case where the thyroiditis already it has diagnosed, and she told that Maga Nandiಗೆ 70-80 ವಯಸ್ಸಾಗದ, above she is 70 plus, and told her ನಾನು ಇರ್ತೀನೋ ಬಿಡ್ತೀನೋ ಗೊತ್ತಿಲ್ಲ, ಡಾಕ್ಟರ್ ಆಪರೇಷನ್ ಮಾಡ್ಬೇಕಂತ ಹೇಳ್ಯಾರ, ಇದು ಪೂರ ತೆಗಿಬೇಕಂತ ಹೇಳ್ಯಾರ. Then she admitted and came back, ಬ್ಯಾಡ ಮಗ ನಂಗೆ ಆಪರೇಷನ್ ಮಾಡಕ್ ಮತ್ ಜೋರತ್ತಿಲ್ಲ. She told that, and I have done Jalokacharana Chikitsa. Next slide please. Next slide. You can see the result. ಮಗ ನಂಗೆ ಉಳ್ಳಕ್ ಹೊಂಟೋದ, ನಂಗೆ ಏನೂ ತ್ರಾಸಿಲ್ಲ, ಊಟ ನಡೆದದ, ಊಟ ಮಾಡ್ಲತ್ತೀನಿ, ಗಂಟ್ಲಾಗ ಸಿಕ್ ಬೀಳೋದು, ನನಗೇನೂ ಪ್ರಾಬ್ಲಮ್ ಇಲ್ಲ, I am perfectly all right. See, we did for 4 sittings of Jalokarana. Weekly we did, and later on regularly we have given Kanchanarakwata and Varanadikwata with honey, with lukewarm water, 15 ml. And here I used Vruddhivadika Gulika and Gandamala Kandana Rasa. Here I have used, and from that she has become completely all right. Now this next case please. That what I told previously, the Mumbai case. This is a very interesting case. She has been diagnosed with thyroiditis. She used to live in Mumbai, and she went to operation theater for surgery. And doctor, before operating, has taken the consent and all this thing. When she entered in the OT, doctor told that मी तुम्हाला ऑपरेशन करतो, मग तुम्हाला गोष्ट यायचं कठीणपण आहे, ನೀನು ಮಾತು ಬರೋದು ಕಷ್ಟ, ನಾನು ಅದ್ರ ಗ್ಯಾರಂಟಿ ಕೊಡಲ್ಲ, ಸರ್ಜರಿ ಮಾಡ್ತೀನಿ ಬಟ್ ಮಾತು ಬರುತ್ತೋ ಇಲ್ಲೋ ಗೊತ್ತಿಲ್ಲ, ಅದನ್ನು ಒಂದ್ ಇದರಲ್ಲಿ ಏನದ ಆಪ್ಷನ್ ಇದೆ, ಅದಕ್ಕೆ ನಿಮ್ಮನ್ನ ಹೇಳ್ತಿದ್ದೀನಿ ಅಂತ. ಸೂನ್ ಆಫ್ಟರ್ ಹಿಯರಿಂಗ್ ದಟ್ ಮಾತು ಆಡ್ಲಕ್ ಬರ್ತದೋ ಇಲ್ಲೋ, ನಿನ್ ಧ್ವನಿ ಹೋಯ್ತದ ಅಂತಂದ್ಮ್ಯಾಕ she came out from the OT, and with her husband she went to her house. They have filed and they have given the charges also for surgery, and she went to house and she refused surgery. And later on she came to me, and his relatives lives in near to the Basavakalyan only. They have given the address, and you can consult the Dr. Basavara Swami, and he has given all the reports to me, and I told that you can come. She came. You can't believe that. From Mumbai she used to come weekly. From Mumbai she used to come weekly. I did Rakthamokshana, and you can see there is no thyroiditis. It was completely cured. I told that nandu weight nu kadime agadri, I am perfectly right, ನನಗೆ ಏನೂ ತ್ರಾಸಿಲ್ಲ, I can do all my works, no problem. And she told that. After 4 years, one interesting story. She has developed severe abdominal pain, a pain in the epigastric region, vomiting sensation, everything. So she was admitted in a hospital there, and they have treated, and USC was done. That was a cholecystitis. Then doctor advised her, you have to undergo cholecystectomy. So cholecystectomy doctor has advised, and again her husband phoned me. ಸರ್ ನಮ್ಮ ಮಿಸಸ್ ಗೆ ಡಾಕ್ಟರ್ ಹಿಂಗ್ ಅಡ್ಮಿಟ್ ಮಾಡಿದೆವು, ಆಪರೇಷನ್ ಮಾಡ್ಕೋಬೇಕಂತ ಹೇಳತ್ತಾರ, ಈಗ ಇಮಿಡಿಯೇಟ್ ಅರ್ಜೆಂಟ್ ಆಪರೇಷನ್ ಮಾಡ್ಬೇಕಲ್ಲತ್ತಾರ, ಏನದ ಸ್ವಲ್ಪ ನನಗೆ ಹೇಳ್ತೀರಿ ನಾವು. ದೆನ್ ಐ ಟೋಲ್ಡ್ ದಟ್, ಐ ಸಿನ್ ದಟ್ ಇಲ್ಲ ಹಿಂಗ ಪಿತ್ತಕೋಶದಾಗ ಹಳ್ಳಾಗ್ಯಾವ, ಡಾಕ್ಟರ್ ಆಪರೇಷನ್ ಮಾಡಿ ಪಿತ್ತಕೋಶ ತೆಗಿಬೇಕಂತ ಹೇಳ್ಯಾರ ಅಂತ. ಮತ್ ಇದ್ರಾಗ ನಿಮ್ ಆಯುರ್ವೇದಿಕ್ದಾಗ ಏನಾರ ಟ್ರೀಟ್ಮೆಂಟ್ ಅದ ಏನ್ರಿ ಅಂತಂದ್ರೆ, ದೆನ್ ಐ ಟೋಲ್ಡ್ ದಟ್ ವೈ ಡೋಂಟ್ ವಿ ಟ್ರೈ, ಕರ್ಕೊಂಬರ್ರಿ ನೋಡೋಣ ಅಂತ ಹೇಳಿದ್ರು. She came, then I told that okay, we will treat this one. After 5 days, what we have given just only some pitta rechakakwata, vasa guluchadi kashayam, and gomutra shilajitu, and tamra bhasma, and ekrut plihari loha, and arogya vardhanivati, and rohita karishta. I have given her, and I have given her 3-4 times basti also to do vatanulomana, and she told that no vomiting, no pain, sir, shall I go? And I told her that you have to come for at least once in a month. Then I have treated once in a month with regular medicines. After that, I told that go for a cross check of the USG abdomen. Then she went to the doctor and she has given her old report and ನಾನು ಸ್ಕ್ಯಾನಿಂಗ್ ಮಾಡಿ ಹೇಳ್ರಿ. Then doctor told that no, ನಿನಗೆ ಸರ್ಜರಿ ಮಾಡ್ಲೇಬೇಕಮ್ಮ, you have to undergo for surgery and today you have to admit. Doctor ಇಲ್ರಿ ಸರ್. And again she called me, sir, doctor ಹೇಳತ್ತಾರ ಆಪರೇಷನ್ ಮಾಡ್ಕೊಂತಲತ್ತಾರ್ರಿ. ದೆನ್ ಐ ಟೋಲ್ಡ್ ನೀವು ಇದು ಮಾಡ್ಕೊಂಡ್ರಿ ಸ್ಕ್ಯಾನಿಂಗ್? ಇಲ್ಲ ಸರ್, ಸ್ಕ್ಯಾನಿಂಗ್ ಮಾಡ್ಕೊಂಡಿಲ್ಲ, ಅದೇ ನಿಮ್ದು ಹಳೆ ರಿಪೋರ್ಟ್ ತೋರಿಸಿದೆ ಅವ್ರಿಗೆ, ನಾನು ಇಲ್ಲ ಮಾಡ್ಕೊಳ್ಳೇಬೇಕಂತ ಹೇಳ್ಯಾರ ಅಂತ. Then I told that sit in a queue, and what I have given the requisition letter, then you show to that radiologist, then whenever your appointment comes, whenever your time comes, then only you go for your scanning. Then she went and she has not talked to the doctor, and doctor immediately started scanning and all these things. Then while typing, the doctor has told her gallbladder is normal. When typing, she heard that one, gallbladder is normal. That's up माझा gallbladder बघा. काय झालं? नाही माझा gallbladder बघतो, gallbladder problem असेल माझा. Then doctor told no, gallbladder is normal. Then her husband told her, sir, previously we did scanning here only and doctor had advised surgery, and now you are telling that gallbladder stone is there, and now before that 15 minutes, half an hour back we came here and you told that surgery and you have to admit. Then the radiologist told me, doctor, sorry, I'm really sorry, but I have done a great mistake today. For your requisition letter, I told them to advise, I told her to admit and go for surgery, but I did color Doppler, everything, but her gallbladder is normal. This is the patient have got the faith on Ayurvedic doctors. Whenever they feel that, whenever that, I don't know that, you can say that how our medicines works fast. This is also thing that, so here we avoided two major surgeries. We avoided this, and this patient, whatever, even though if it's she will gallbladder, even if it's least, she will call us and she will tell that doctor मला काय तर आयुर्वेदिक medicine advice कर. Now she is perfectly all right. This is of and Mumbai and all these things. Next sir, please. This is also Galaganda case. Here we applied Gelocas and doctor also advised surgery for this case also. And how a wonderful thing, one thing what I want to hear, what I have faced the problem. After applying 6 Gelocas, from the mid, where I don't know, that blood started like a, what you can say, fountain. Karanjang Raktar started. I became afraid after removing the Gelocas. I put 3-4 pads on that, even though it is oozing. Then I afraid what to do, to whom I have to call, whether I have to consult the surgeon. Well, if I call the surgeon, he will scold me. Are beku bidinri ella hang ಮಾಡ್ತೀರಿ. Once I told that no, then what to do? Again, I have planned, just I have taken, what you can say, that Spatika. I have done Spatika applied, and I did Haridra Lepana and done very tight bandage. After 10 minutes, it was stopped completely, and I told that nothing to worry, and you can stay today here only with me, and we'll plan for the next. And tomorrow I checked the dressing. There was no bleeding, nothing, comfortably. I was very happy. I have taken a long breath that day, and patient has not given any complaints. This is the thing. And patient And after that curing, I am not having this photo. She went to Mumbai for her work, and I am not having that photo. Next slide, please. Next slide. And this is CA of thyroid. CA of thyroid, and almost all here, the patient has done everything. Conclusion was that surgery was the ultimate and final, and she came to me. She's 74 years old lady. She is about 74 years old lady. MRI, neck, everything was done, and that is Paradise, everything is done, and doctor has given that follicular adenoma or follicular carcinoma. It has been diagnosed. And again, this patient also, when the previous old lady, along with the same villagers, sees. And told why 70-75 ಇವತ್ತು ನಾಳೆ ಸಾಯ ವಯಸ್ಸಿನಾಗದ ಎಲ್ಲ ಆಪರೇಷನ್ ಮಾಡ್ಕೋತಿ ಏನ್ ಮಾಡ್ಕೋತಿ ಆಪರೇಷನ್ ಮಾಡ್ಕೊಂಡ್ರೆ ಬಿ ಉಳಿಯಲ್ಲ ಏನಿಲ್ಲ ಯು ಗೋ ಟು ಬಸವ ಕಲ್ಯಾಣ್ 600 and I have treated 4-5 times. Again I have applied and so ಮಗ ನನಗೇನು ಪ್ರಾಬ್ಲಮ್ ಇಲ್ಲ, ನಾನು ಉಳ್ಳಕ್ ಹೊಂಟದ ತಿಲ್ಲಕ್ ಹೊಂಟದ, ತಕ್ಲೀಫ್ ಏನೂ ಇಲ್ಲ, I am perfectly all right. Again I have given the Varunadi Ghrita here in this case, Varunadi Kashayam and Kanchanara Kwatha along with honey and with lukewarm water I have given, and here Vruddhivadika Gulika, and here special is Sarveshwara Parpati I have used in this case. Sarveshwara Parpati and Gandamala Kandana Rasa, Kanchanara Gugulu, double strength I have used, and this patient has become absolutely normal. Now she also phones that I am comfortable, I am all right. This is the case what I have done in this picture, in this slides. I have some. Next slide, please. Next slide. Next slide, please. Weekly, I have applied 4-5 up to 6 Jalokas. I have applied. Now you can see the result. Next slide, please. You see the show the next slide. You can see. You can apply to the leeches. 4-5-6 leeches I have applied. Next slide. Next result. So comfortably, she is all right. Later on, she told that maga mark avalla yen madbeku. Old lady asked me what about the mark. Just I applied the Shatadhauta Ghrita. For that, that has been the marks also disappeared. Now you can say. So regarding CA, Vrunashofa and all these things, you have almost all you might have been seen. Now here for cosmetic purpose, what we are doing in acne vulgaris, Mukha Dushika, you can say that. So in Mukha Dushika, here we are doing the treatments, how the Jalokas will give results, and the symptoms are as in Mukha Dushika, Sushrita Nidhanasthana, 13th chapter, 39th shloka, he has given that Shalmali Kantaka Prakhya Kafamaruta Shonite Jayante Pidika Yona Vaktreya Mukha Dushika. He has given that Shalmali Kantaka. Shalmali Kantaka, that resembles like the Shalmali. That's the thorn. That's like a nail. Shalmali Kantaka. ಆ ಮುಳ್ಳಿನ ತರ ಇರತಕ್ಕಂತ ಮಾತಾಡ್ತಾನೆ. Jayante Pidika Yona Vaktreya Mukha Dushika. All around the. This is a Kapha Maruta Shonita. Here is the combination of Kapha, Vata and Rakta Dosha. Here is, he has given the clear cut pictures. And why we should apply the Jaloka? Here the treatment. The Vangachana has given that Yavana Pidika, Necha, Nilika, Vengya, Sharkara, Shiravedhe, Pralepachate Jayate, Abhangani, Stataha. Here is that here that Shiravedha. He has to do Shiravedha. This is the Vangashana's treatment reference, and he has given the taken as Rakthamokshana treatment. Next slide. Next slide, please. This student, he is studying in the PUC second year. PUC second year, he lapsed 1 year because of this Mukha Dushika. सर मैं जब भी खाना खाना जाता हूं तो मुंह खोलता हूं तो हाँ से पशीश निकलता है ऐसा ऐसा. You can see that such a big vulgar. You can see that to see it is a vulgar, and when he opens the mouth, the pus is to start automatically draining, and he starts opening. And he has consulted with almost all dermatologists, almost all. There's which is super specialist. He has consulted and he has taken almost all treatment with dermatologist. And later on, he came to us, and I told him that yes, sir, we will try. सर 1 साल मेरा गया, मैं पीयूसी सेकंड ईयर में पढ़ना हूँ, मुझे इंजीनियरिंग वगैरह करने का बहुत शौक है सर, मैं इससे बहुत तंग आ गया हूँ, प्लीज सर कुछ तो करो इसको. ऐसा डॉक्टर नहीं है, सभी स्किन स्पेशलिस्ट के मैं जाके आया, इससे मेरा ट्रीटमेंट होता या नहीं होता, मैं बहुत परेशान हूं सर, इसमें मेरा तो लाइफ कोलैप्स हो गया, बर्बाद हो गया मैं. देन आई स्टार्टेड जलोका चरणा. यू कैन सी, and after that you can see this is more than 5 to 6 sittings I have did. Next slide please. And after that you can see the result. Here I have given Lodra Lepa, and his I have used what you can say that the drugs are, and Raktamutakwata I have used here, and Mahatikta Grita I have used, and one more thing, what you can say that Rasamanikya I used in this case. Gandhaka Rasayana I used. He has got complete relief. He has completed the B सक्सेसफुली. एंड कभी भी फोन किया करके बोलता है सर मैं बहुत खुश हूँ आपसे ट्रीटमेंट से, सर नहीं तो मेरा अभी 3-4 साल बर्बाद होता था, मैं ना बीए करता था ना मैं ग्रेजुएशन करता था. दैट्स माय हैप्पीएस्ट मोमेंट. एंड once I came to Bangalore and he met me in bus stand. सर कहाँ जा रहे हो? नहीं सर मैं ऐसे गाँव जा रहा हूँ. क्यों? नहीं नहीं बस का मैंने ऐसा तो कौन सा भी बस नहीं है सर, मैं चेक करता हूँ. सडनली he went to the bus stand and he has brought the ticket for me. नहीं सर आप मुझे पहचाना नहीं, मैं आपके पास ट्रीटमेंट लिया था, आपका मैंने आप मेरा ये हुआ था, अरे यार सॉरी आई हैव नॉट फंड. एंड ही हैज गिवन मी द टिकट एंड ही हैज अरेंज्ड द बस फॉर me to from Bangalore to Basavaraj on that day. This much of the happiest moment we can feel as an Ayurvedic physician. Now next slide please. This lady, she is a girl, she is not married, and she told that sir my whole charmness has gone, and since 3 to 4 years I have shown to all dermatologists, all skin specialists, till to see that my how that I have lost my gloom, I have lost my charmness, everything I have lost sir. Again we did her Rakthamokshana Chikitsa, and once I did her Virechana also. You can see the glow. After that she said, sir my face is charming like anything. That glow I am having, this type of treatment you can notice. Same treatment the Shamanotasis we have given. This is the result. You can say next. This is the see her beautiful face. This is the thing by Rakthamokshana we can treat. We can consider as Rakthamokshana is the half of the case. Next slide please. You can see, next see her beauty face. Next, this case also we did same, you can see the result, and this is also case. You can next slide you can see the result. This type of Rakthamokshana, now this is also same Mukhadustika case we did almost all. He's also completed the treatment. Now he's still that he's having the lessons of also the whole body also is having, and everything we did Rakthamokshana, and for him I did jugular vein Rakthamokshana also did. After that it has got a very good result. Next case, CA of breast. This is a diagnosed case. After he came to me and he went to oncologist and also types of operation ಮಾಡ್ಬೇಕಂತ ಹೇಳಿರಿ ಹೆಂಗ್ರಿ ಅಂತ ಹೇಳಿ. After 3 months again he came, sir ನಮ್ಗೆ ಆಪರೇಷನ್ ಮಾಡ್ಕೊಳ್ಳೋದಿಲ್ಲ, we want to undergo Ayurvedic treatment only. We did Jalokacharana, Rakthamokshana Chikitsa here, and Agni Karma also here we did, and this is also under continuation of the treatment. And the what you can say that ductal carcinoma. It was diagnosed, and even she is having multiple fibroid of the uterus and cirrhosis of liver. Everything she is having, almost all. Now she's telling that, so I am very comfortable with Ayurvedic treatment. Agni Karma also I did her, and even I have given Basti also for this because of her fibroid and all these things. Now she is that metastatic nodes, that what you can say, that this ductal carcinoma also we are treating successfully. Next slide, Agni Karma, and next slide. Yes, this is also CA of breast. You can see 5 years, 4 years, I think she's came to me 4 years back. Doctor told that, sir, doctor told me that ನನ್ನ lungs ಎಲ್ಲ ಪೂರ all over infected. So doctor has given me 1.5 month time. The doctor told me that 1.5 month only. And her son-in-law is my friend. Her son-in-law is my wife's brother's friend, and he referred, and he came with her son-in-law, and we started Jaloka Charana, whole mass reduced, and that what necrosis has taken place, we removed by Agni Karma. Next slide, please. So after that Jaloka Charana, we removed, not surgery, by simple Agni Karma, we removed her nipple, and we were doing Ropana Chikitsa since 4 years. She is with me, and she is telling her, सर कभी ट्रीटमेंट लेता हूँ, कभी नहीं लेता हूँ, कभी 1 महीने के बाद आती हूँ, कभी 3 महीने के बाद आती हूँ, लेकिन मैं अच्छा हूँ, मुझे कोई तकलीफ नहीं है. अगर कोई तकलीफ है तो मैं आती हूँ. This is the remedy. Now also I am doing, I told her that do dhupana regularly in our house. So this is also, so we can say that such encouraging results we are getting with Rakthamokshana. And you can see the result here. And next, shall I continue?
Yes, 10 more minutes. You can 10 to 15
Okay.
minutes.
10 to 15 minutes. I
No
think
problem,
that
you can continue, sir. We can stay, Dr. Geeta, because
Okay.
you are sharing really wonderful cases with results. That what actually we need for boosting our confidence in this, because results are really amazing, sir. Please continue.
so 20 years experience, madam. It is how you can't imagine that. Everyone says we are afraid that from super specialty hospital comes means we feel that no, khatam, हमारा हाथ उठाने का ही होता है. That's why I told that try, knock the door,
Yes, sir.
knock the door till it opens. This is my principle, because Ayurveda is such Vedas. They never tell lies. Vedas never tell lies. That we have the trust on that. We trust our system. We trust our pathy. Now,
Yes.
next,
It's very
I
nice,
will.
and it is actually great salute to your courage, sir. Because
No,
please
no, it
continue.
is. We have to salute our acharyas, madam. They have given us, given us a nectar. We are in our hand. We are having the nectar, but we are unable to swallow it. That is the problem. Now I can say that next slide is of Kaksha. It is of herpes zoster. Herpes zoster, whatever you can say that. बाहु पार्श्वास कक्षासु कृष्ण स्फोटा सवेदना पित्त प्रकोप संभूता कक्षमिति विनिर्दिशेत. In Shushruta Nidana Sthana, 13th chapter, he has given the reference of this Kaksha. So we are correlating with herpes zoster. Here, multiple blisters in the arms, lateral chest wall, shoulder, and axilla associated with severe burning pain. Associated with severe burning pain. Acute eruption, consisting tens, vesicles in groups, and severe burning pain. Almost any segment of the body, including cranial nerves, may be involved. The lesion tend to dry up spontaneously with 7 to 10 days. Complications, pain, and paresthesia. The complications are pain, paresthesia, and post-herpetic neuralgia. So burning, severe burning sensation. Whenever the patient will come, sir, they will tell that, "Nahi sir, बहुत जलन होता है, दर्द होता है, बहुत जलन होता है." तो जलन सह नहीं सकते हैं. That much of. And only the remedy is Acivir. The remedy is the only Acivir. How long they will take Acivir? Even though after taking the Acivir, they were not responding for that. So, treatment he has, Sushruta has givenly given Pitta Jasya Visarpasya Kriyaya Sadhaye Bhishak. Treatment is same as Visarpa. Yani Tani Hokani Visarpani Chikitsa Rakthamokshana. He clearly has mentioned. And here, see, next slide, please. You can see the pictures. Next, I applied more than 2 to 3 sittings. Only after first sitting, the patient, sir, burning has completely reduced, pain has completely reduced. Now I am comfortable. And that day she told that I got a fine sleep, sir. I slept very nice, and today I have eaten everything normally. Next day, the patient has given the result. You can see the result. After second sitting of Jalokacharana, we have got such wonderful result. And people, and even Gairika Lepa also we used to do. And I used to give you what you can say, Gairika Lepa and Shatadota Gurta we used to apply. And orally, Sariva, Arogyavardhini, and Kamadugdha with Mukta we have given. And Pitta Rechaka and Raktamruta Kota we are using regularly for this kind of. And Bhunimbadi Kada. To be frank with you, Bhunimbadi Kada is a very excellent result in this case. I am using Bhunimbadi Kada for such cases. Next slide, please. You can see. You can see. Next slide. Next slide. You can see. Next slide. This is the results with confidence we can treat herpes. It may be the report. Maybe you can say that some cases you will get the HIV infections also, but I am not bothered. And before going to do that, I used to do and HIV and all investigations VDR we has to do. But in one case I have got HIV positive, and even though that case also I have treated with Jalokacharana only. And next case, you can see that this is also a very you can see that he jalan sir, jalan, and somebody told that, sir, if it crosses I will die, if it circulates to my trunk I will die, sir. Somebody is telling that. And after Jalokacharana, only first sitting, he told that, sir, मुझे बहुत अच्छा लगा, but जलन कम हो गया, बहुत कम हो गया. This is the next slide, please. This is the result. Now, Visarpa, erysipelas. So here, Tvagmansha Shonita Gata, Kupitastu Dosha, Sarvanga Shirana, Sarvanga Saryana, Mihestitama Lingam, Kurvanti, Vishruta Manunnata Mahatanshu, Shofam, Tam, Sarvato, Visarnacha, Visarpa Mahu, Visarvato, Visarpanat, Sarvato, Visarpanat. Here, why I have taken as Rakthamokshana Chikitsa here? In Visakasada, Sretam Visarpesu Chikitsam Hi, Sarvanga Shapakwan Parishadharman, Runa Krama Lopa Chere Deko Raktam. Here. And in Charaka Chikitsa Asthana, he has given that Yani Hoktani Karmani Visarpanam Nivruttayo Ekastatani Sarvani Rakthamokshana Mekataha. He has clearly mentioned Yani Hoktani Karmani, whatever the karmas you can do, Visarpanam Nivruttaya, to get rid of the Visarpa, Ekastatani Sarvani Rakthamokshana Mekataha. Has given importance to Rakthamokshana in Visarpa. This is the Charaka. He has given a beautiful quotation. This Rakthamokshana Mekataha. That is Charaka Chikitsa Asthana 21 chapter 141 Loka. Now, next slide, please. You can see the case what I am presenting here. Okay. Next slide, please. You can see the result. So, next, Next, I won't do the Granthi and all these things. Almost all here the Shirashota, thrombophlebitis, everything one by one. Just I will show the slides. I'm not going to give you the descriptions or all these things. Here, in almost all cases, I have done Doppler test, USG, everything in these cases. And in DVT also, I have got very excellent results. In Vidradi, you can see that. You can see Vidradi. Next slide, please. Next. That is Shirashvata, what I have done. I am telling you that thrombophlebitis. You can see the results also. Very encouraging, 100%. You can say in thrombophlebitis, varicose vein, varicose ulcer, we are getting the results. In Vidradi, next, you can say that. Vidradi, abscess, you can give here what we are telling is that Vidradi. In Vidradi, treatment has clearly given that Vukta Vidradaya Shadyo Teshva Sadhastu Sarvaja Shesha Swameshu Kartavyat Varitam Shofavat Kriya. Shofavat. When I was taking of the shofar, there what he has given that Dustrastra Pagate Shofa Sadhya Raga Ruja Shamam. Like Shofa, we have to treat. And Vidradim Sarvamevamam Shopavat Samopachare Pratatam Cha Hared Raktam Pakvetu Vrnavat Kriyaha. Here he has given. And the Vangasena Chakarata commentary has given that Jalokapatanam Shastam Sarvasvimanam Vidradev Murdvikam Lagavam Svedaha Pittodbhavam Vina. Like that we have to treat. He has given Jalokapatanam. Here is given clearly. You do Jalokapatana in Vidradi. Now you can see the cases what I have done. In Pittaja Vidradi also Sushruta Chikitsasana Jaloko bhi Harik Shasru Pakvam Chapacha Buddhiman. Jaloko bhi Harik Ashru. By Jaloka you can treat Vidradi. This is Sushruta Chikitsasana 16th chapter 12th sloka. He has given the reference for Jaloka Charana in Vidradi. From that you can treat the patients without any I and D and all these things. By Jaloka Charana only you can do. And in Kafaja Vidradi also, Yathodishtam Shiram Vidher Kapaje Vidrade Obishak Rakta Pittani Lottesho Kechidraho Vadantitu. And Sukshatikitsa 16th chapter 34 in he has explained that in Kapha and Rakta Vidradi you can do Rakta Pitta treatment like Rakthamokshana. You can see the cases. Next slide, please. So you can see the Vidradi. Here I applied the Jaloka. Second, you can say next slide. Next slide. Next slide. You can see the result by Jaloka Charana only. By Jaloka Charana only. Next setting. Next, you can see that small Caesar, 8th standard girl. Next slide, please. You can see the Vidradi. Here I applied the Jaloka. Next, next slide, please. This is one or two sittings only. One sitting completely. The pus is to come out, drain completely. Then says patient says, "Sir, bilkul aaram hai. Koi taklif nahi." You can see the result. This is one more small baby. Here you can see that beneath the next slide, please. See, here is the Vidradi. Below the small girl, small kid. I applied the Jaloka, started crying, and even though her mother, she has cooperated very well, this baby has cooperated very well. I can't believe that the babies. Next slide, please. See the beautiful face. This is the result. Next slide, please. Sthana Vidradi. In case of Sthana Vidradi, soon after doing Jaloka Charana, no need. I have not faced that problem that to IND, do IND and all these things. Immediately the pus has drained. Immediately, soon after Jaloka Charana, when Jaloka left and started the pus draining Here, one kidney tray first has drained. Later on, I did Runaropana Chikitsa. You can see the result. Next slide, please. Yes, you can see that as a historical abscess, perennial abscess, whatever it may be. And it's a known case of diabetes. And doctor told that, and he's having the sorry, what you can say that he has gone coronary angiography, and he has operated for that. He has been he has undergone angioplasty, and he's also on ecospirin. He's also on ecospirin, and we stopped ecospirin for 2 days, and we did Jalokacharana. You can't believe more than 1 liter of pus I drained. That video I'm not having, that which is missed. You can't believe 1 liter of pus I have drained, and the patient next day told that, Dr. Saab, bahut acha. ಭಾಳ ಚಲೋ ಐತ್ರಿ, ನಂಗೆ ರಾತ್ರಿ ಬೆಳಗನ ನಿದ್ದೆ ಹತ್ತಿಲ್ಲ, ನಂಗೆ ನಿದ್ದೆ ಆಯ್ತು. And after that we did dressing and all these things. Next slide, please. Next slide. This is also Vidarthi case. Next slide, please. And next, Sleepada case. In Sleepada, filariasis you can take as a elephantiasis. Here, what the patient used to come with almost all oozing case and all these things, and severe pain and all these things, and weekly, monthly, they will say, sir, I'm getting fever, rigor, chills, and whenever it starts and oozing, it soaks my clothes and all these things. I feel very irritated. In such cases, Sneha Svedopapannetu Sleepade Anileje Bishak Krutva Gulfopari Shiram Vidhetu Chaturangale. Yes, given that Gulfopari Shiraveda Chaturangale. Above the Gulfo region of Chaturangala, where we have to do Shiraveda, and Gulpashada Shiram Vidhe Padite Pitta Sambhave Pittagni Cha Kriyam Kuryat Pittarbuda Visarpavat. Like that, again he has told that Visarpavat Chikitsa he has to do. And Langhana, Alepana, Sveda, Rechanai, Raktavshechanai, Pravaya, Slekmarari, Ushnani, Sleepadam, Samupacharet. Chakradatta has given this quotation where he has given that Sveda, Rechana, and Raktavasechana we have to do, and we have to do Alepana and Slesmahari and Ushna Chikitsa we have to do in Sleepada. Next slide, please. In this case is beautiful. You can see that oozing and everything it was done, and I have seen that after that we have applied the Jalokacharana. After third sitting of Jalokacharana, you can say that oozing has completely stopped. And next slide, please. You can see the result. And patient will nice, sir, ಇದು ಟ್ರೀಟ್ಮೆಂಟ್ ಕೊಟ್ಟಾಗ ಭಾಳ ನನ್ ಕವರ್ ಆಗ್ಯದ್ರಿ, ನನ್ನ ಕಾಲು ಬಾವೆಲ್ಲ ಹೇಳ್ದರಿ. You can see that the swelling has reduced completely. Here we are using what we can see that Nityananda Rasa. Here we are using Sleepada case we are not getting Varnadi Kashayam we are using in this case, and Putikaranjasava we are using in this case. And definitely you can say that in allopathy there is no remedy for Sleepada or filariasis or antiparesis, but by Ayurvedic, and you can do daily with Nalapamaradi Taila Abhyanga and all these things, Manjistadi Taila Abhyanga. If you do regularly, the patient won't get all this oozing and all these things. Definitely you can say that this is the boon, Rakthamokshana, Shiraveda in case. And most of the patients, they will convert into cellulitis and Kota, Utkota. One patient, that photo I'm not having that. He's a boy. He has developed severe elephantiasis. It was totally necrosed. Even his parents, they are not. Even that foul smell you can't tolerate. Such cases we treated with Jalokacharana. We used to do dressing daily, and after that 1 month, that patient's limb has become completely normal. That's why now in case of WHO, they were believing that to treat Sleepada or filariasis or elephantiasis, we have to approach with Ayurveda and the integrated system. and somebody is treating with integrated system only with these cases. So here you can say that integrated system works beautifully here. So this, and next case, this is I shared with Dr. Geeta this case.
Yes.
Yeah, Dr. Geeta, you know?
Yes, yes, yes. Ptosis and paralysis, facial
Yes,
paralysis.
facial paralysis, and totally he has lost the vision. And he told that first when he came that diplopia, I used to see everything two. Even I can't, if I want to walk, I could not put my leg front. He told that kabhi idhar once like it ಆಗ್ತದ ಒಂದ್ಸಲ like ನನಗೆ ಏನ್ ನೋಡಿದ್ರು ಹಿಂಗ್ ಕಾಣಿಸ್ತಾವ ರೂಟ್ ನನಗೆ ಎರಡು ಕಾಣಿಸ್ತಾವ ಬಟ್ ಐ ಕಾಂಟ್ ವಿಷನ್ ಗಾಡಿ ಮೇಲೆ ನೋ ನನಗೇನು ಕಾಣಲ್ಲ. He is my very close, dear, and nearest friend. Those now the slide is sharing. No, his father. He is a teacher. With his permission only, I have taken his photo. Otherwise, I have put it everyone black strips on their face to disclose their identity. So here clearly, I did when he told that we have done MRI, CT, everything. Doctors told maybe, may not be. You will get the vision. And all this thing in the puzzle. He is also in CQS. He is also diabetic. So what I have to do? He is very close. I told that, Anna, yen madada neene madu. Now I won't go anywhere. Whatever it may be. I told that ಇಲ್ಲ ಅಣ್ಣ ಶರತ್ ಪವಾರ್ ಅಂದು ಆಮೇಲೆ ಬಂಗಾರಪ್ಪವ್ರದ್ದು ಅವ್ರದೆಲ್ಲ ಒಂಕಾಗಿದ್ ಬಾ ಇನ್ನ ಬಿ ಟ್ರೀಟ್ ಆಗಿಲ್ಲ ನಮ್ದೇನಾಗ್ತದ ನಿಂದೇನಾಗ್ತದ just I made just fun with him. Then after applying Jalokacharna Rakthamokshana I did. You can see. Next slide, please. Next slide. After that, you can see that face. Next, you can see Rakthamokshana. His eyes started opening completely. Next, I did Nashakarma also for him. I did Nashakarma also him, and you can say that when next after 5 years, again he has got 3 years. Sorry, after 3 years, again he has got the facial paralysis. And after that also, I did Rakthamokshana with Jalokacharna, and I did this Prachana Rakthamokshana also. Next, you can see that. Next slide, please. Gadha, Avagada, where there is a Sroto, Avarodha, you can do with blindly Rakthamokshana. That sucks not only 4 angulas, it sucks from the all Gada, Avagada, it is Kathanya, the Jaloka will suck the blood because the hirudin, it circulates all over the body. Now you can see, now he is working, he is teaching, he is riding the bike, he is car driving, everything with, and later on I did him Shirodhara and Basti Chikitsa also I did. But apart from this, Nashya and Rakthamokshana has given him the excellent result with confidence. He used to tell that whatever it may be, Anna, what you did is first Jalokacharna, that is the treatment. With confidence, he will tell, and he will tell that whenever the place comes, hey, he came with his 2 more friends. Hey, Anna, pahila the leech application mad. Adu madare first bartadu. That much of confidence he developed, and now we can see the result in front of you. This totally what I did, encouraging. We can say that's why Bhagwan Dhanvantari is having Jaloka in his hand. That's why we treat Jaloka as a god. I don't think it as a insect. Now, coming to my favorite case now, my specialization, where we are dealing with arshas. Arivat pranan shrunanti hinastiti arshaha. You can see, like enemy, nobody will give us the trouble, but the piles give us that much of trouble. Then what to do? Is there surgery is the only ultimate remedy? There may be. Here is, I thought, here is the troubleshooter is Jaloka. In thrombus piles, inflamed piles, blindly, I used to do Jalokacharna, Rakthamokshana. I feel myself personally, I used to do Kshara Sutra previously, and I used to do Kshara Lepa, but
when I heard that in Charaka Chikitsatana, because Charaka is a physician, he has given that Jalokovistata Shastre Shuchirbiva Punah Punah Avartamanam Rudiram Raktarshabhyam Pravahayet. See that? What a beautiful quotation he has given. Jalokovastita Shastre Shuchirbiva Punah Punah Avartamanam Rudiram Raktarshabhyam Pravahayet. By doing Punah Punah, regularly you have to do Rakthamokshana with Jaloka. Shastraivatah Jalokabehi Prochano Katinarshasa Shonitam Sanchitam Dustava Haret Pragnya Punah Punaha. This is the Vangasena's reference in Arshodikara. Shastravit Jalokabhi Prachona Katinarshasa Shonitam Sanchitam Dustam Haret Pragnya Punah Punaha. And you do regularly. Don't feel come nahi hua, first sitting mein come nahi hua. Don't get afraid. Sir, result nahi mila. Do second time Jaloka Charana after 1 week. Do even I did Jaloka Charana in the HB level was 4 grams. HB level was 4 grams. I got the result. And don't everyone will ask that. डॉक्टर साहब वहां पर जलोका लगाने के बाद अंदर जाता है क्या, और अंदर जाने के बाद वो ईस्टर स्टेंट को पकड़ लिया, उसको पकड़ लिया, फिर ब्लीडिंग ज्यादा होता है. Don't think that. Don't say like that. Don't be afraid. Even though if the jaloka enters, whenever if you apply there, it will stick there only. It will never enter in the anal region. By mistakenly, if even though it enters, just if you give what you can say lavanodaka basti, only lavanodaka basti you can give, it will come out. It will leave it, no problem. And just you can do just simple water ropana basti with jatadi taila and estimadu taila, nothing. But till today, I have not noticed that it has entered in the anus. Even though with proctoscopy also I applied. You can see the case. Such a wonderful cases. You can see this lady unable to sit. She came by bus and she slept just like a rolling pen. Sir, taklif halak baradri inam dushmanugunu barabadri inta taklifa. She used to say, Arivat pranan shnoti hinastiti. That word she has given this. Arivat, Shatru, nam dushman, nam vairigaligu iriti, tras barabadri antakanta mat, what she told that. And soon after that, I applied Jaloka. I have not tested anything blindly. I have not even done her CBC and whatever it may be. I have told her, nang paile bani kadin madri. She has taken anti-inflammatory and painkillers, antibiotics, everything she has taken. See, next slide, please. See the result. It is only in second sitting only. Got the result. And advise her to do sitz bath for 3 to 4 times daily. I have advised 3 to 4 times sitz bath with Panchavalkalakvata, which has reduced, and I have given orally Suranadileham for this case, along with Trifala Gugul, whatever the treatment, line of treatment, you can choose. But Jaloka Charana is the remedy. I can say that we say thanks to Charaka physician, such quote he has given us regarding this Arsham. Next case, please. N number of cases I did with Jaloka Charana with that much of confidence. You can say, you can see the case. Next slide. This is the result. 3-4 leeches also I applied for this condition. Next case. This patient has undergone 3 times surgery. 3 times he has undergone. Now we can see that such bleeding. It can say that. You can say I applied. Next slide. Next slide. See the result. Next slide. So next slide, please. Hello. Next, please. Previous one. Previous slide, please. Yes, you can see the result. This much of confidence. With confidence,
we can treat arches. Next slide. This is also we applied. Next slide, please. This is the result. Wonderful. Can say that patient told that, sir, ಆರಾಮದಾರಿ ನೆಕ್ಸ್ಟ್ ನಾ ಊರಿಗೆ ನಡೆದೀನಿ, ನಾ ಮತ್ತೆ ಯಾವಾಗ ಬಂದು ತೋರಿಸ್ಕೊತೀನಿ ಗೊತ್ತಿಲ್ಲ, ಬಟ್ ಈಗಂತೂ ನನಗೆ ಆರಾಮದಾರಿ. ನಾ ಮೆಡಿಸಿನ್ಸ್ ಅಲ್ಲೇ ಎಲ್ಲರ ಸಿಕ್ಕರು ಬೆಂಗಳೂರದಾಗ ತಗೋತೀನಿ ರೀ. ಬೈ ಆಲ್ ದ ವೇ ಶಿ ಕೇಮ್ ಫ್ರಮ್ ಬೆಂಗಳೂರು. ನೆಕ್ಸ್ಟ್ ಸ್ಲೈಡ್ ಪ್ಲೀಸ್. Next slide. So nobody will dare to touch. Nobody will make the dare to touch this case. And in this case, you can see that even though it is bleeding, I have applied 3 to 4 Jalokas. Next slide. You can see it is after second sitting, after third sitting, completely vanish. This is why you can think that why Dhanvantari is having Jaloka in his hand. Then Jaloka is, I personally give such respect to Jaloka because of this reason only. Next slide, please. See that this is also inflamed thrombosed piles, 3rd degree prolapsed piles. Here I applied leeches. Next. See, after second, third sitting. Next slide, please. Completely cured. And in between, I used to give Anuvasana Basti with Jatyadi Taila and Estomadi Taila. I used to give Basti also to patient feel comfortable. Don't get any pain and all these things. And I'll advise for SIDS bath compulsory. Next slide. This is also same case. Next slide, please. Next slide. This is the result. And this is a special case for me. This patient has undergone hemorrhoidectomy. He has gone laser surgery twice, once hemorrhoidectomy. Again, he has developed this, what you can say, the thrombosed piles. Here you can say I applied leech. Next slide, please. After second sitting of Jaloka Charna, you can see the result. And after that, I have given him the Kshira Basti also. I did him for 1 week on alternate day with the St. Madhu Kashaya. Excellent result. And he told that thanks to Ayurveda. Next slide, please. Like this, n number of different types of piles you can see. Next slide. And now the patient is coming that, sir, piles hulastirantallri ನೀವು ಅಂತ ಹೇಳಿ. ಅಚ್ಚಾ ಹುಳ ಇಲ್ಲಪ್ಪ, ಅದು ಹುಳ ಇಲ್ಲ, ಅದು ದೇವರದ. I will say that these are the cases what routinely now I am having with me. I am just blindly we are doing. Even our assistants, sir, leech ready ಮಾಡ್ಕೊಳ್ಳೇನ್ರಿ ಅಂತ. And patient comes, this is it. This much of confidence we are having this type of cases with free and with daring. You can do the Jaloka Charana. Now this is n number of cases I am having, more than 100 cases slides I am having, but now this I am not going to just because of lack of nobody. Otherwise, I think that almost all I have covered here. Just with ready everything I clear. Next slide, please. Next slide. So this is also eczema. Next slide. In Kushta eczema, where skin diseases with the daring you can do skin disease, eczema, psoriasis, and all these things without any hesitation. You can do Rakthamokshana. If it is Kapha Pradhana or Pitta Pradhana, there you can use. You can see the results here. And one more thing, and plantar is also psoriasis, and that lichens also. Next slide, please. This eczema where we are treated with Jaloka Charana. Next slide. The result. And next slide. This is also psoriasis. Next slide. Eczema. Next slide. The Sensia. This is a very royal case. Since 6 months,
and he used to apply any ointments, any steroid applications, never it has subsided. This condition, pus discharge, everything was present. Here I applied Jaloka. Next, please, next slide. And after Jaloka Charana, you can see I done, you can see the cupping also I done. Prachana Rakthamokshana I also done. After Prachana Rakthamokshana and Jaloka Charana, next, you can see, next slide. Next slide, please. See the result. Wonderful. No itching, nothing, no applications, nothing. Patient is perfectly all right. So in skin diseases, Kushta, Masa, and this what Charaka has given us the clear-cut picture. So Virechana, whatever you can do, but whatever you can do, you do Rakthamokshana. Next patient. Ardhava Bedaka in migraine. See, and no, previous one only. One lady doctor, she is a MDS. Her family members all are neurophysician, neurosurgeon, and she is also MDS. She told that every time, sir, when I get this headache, even I won't go to OPD also. Vomiting, headache, burning, severe. Whether is there remedy or not for this? I have consulted with all foreign doctors also. I have consulted all foreign doctors, and even my family members are all physicians and neurophysician surgeons, and they have also given. There is no remedy. Now I am become fed up with this disease. Please give me any remedy from Ayurvedic side. The day once she came and I did a Jaloka Charana applied, and next day she phoned me, Doctor Sahab, they what you have given the treatment, excellent. This is an excellent remedy. I have not got the headache. I have not got the headache. Otherwise, I should have vomit once or twice. Otherwise, I have to sleep. I am not getting sleep. But today, I slept very sound sleep. She has given. This was the result. Ashu Chikitsa. Ashukari Chikitsa is Rakthamokshana. You can say that with confidence. And she has more than 100 patients she has referred to me. So doctor, I'm very really thankful. And later on, I did her Nashakarma also. And she told that really Ayurveda is great. No doctors, please doctor, you can don't. Even she never advised a single drug. Even she won't prescribe the paracetamol or whatever it may be. And she refers to directly as very case. Next case. Next slide, please. This case, very, I can say that I have, with confidence, I can say that how I diagnose the disease, I don't know. I won't believe. And you don't ask question for this case. I don't ready to give any answers for this case. This case is of multiple hole dural AV fistula. This is a case of multiple hole dural AV fistula. He came with the complaint that blurring of vision, and there is no sense in the limbs. Literally, he came to my hospital. Somebody has came that it was blind, and his wife and with his wife he came. He told that where is doctor? Where is Doctor Chamber? And he came and sit in front of me and told that doctor unkan cancel. Then what you have taken? They have given the file, everything, and he has undergone diagnosed in the neuro center that multiple hole dural AV fistula, and that his brother has narrated and his wife has narrated everything, clear-cut pictures, and the doctor told that 25 lakhs for surgery. 25 lakhs for surgery, and they have assured that we are not giving the hopes. You won't get the vision. He almost all consulted the ophthalmologist, neurologist, neurosurgeons, and that you can say that after that, with hopes, we came to Ayurvedic doctor. Nam mane ellorige Ayurveda mein bhal vishwas adari. And what I told you that previously, that patient has referred, and same case, this case has been referred by that great Swamiji, that Nadadadava Devaru. What I can feel that he only referred to me this case. And after doing this, when he came to me, embolism and everything, I studied everything. Then I told that whatever the Shroto Avaroda, whatever it may be, let me try Jaloka Charana first. Then after 3 sittings, he told that, Doctor, idu kempu gadari. Doctor, idu yellow adari. Doctor, idu yellow adari. Literally he's telling that. Then I told that, what is my shirt color? He recognized my shirt color. And he told that. And I told that, how much? 1, 2, 3. Started his, no, 4. Yes, he started counting. Sir, hontrodri. Nan kan hontavri. He told that literally. Then, after Jalokacharana and Prachana Rakthamokshana, I did him Shirodhara and Basti treatment also I did. And I also did Prachana Rakthamokshana. After 3 months, next slide, please. See the video. See the video. It is a Gulbarga city. In Gulbarga city, he is riding the bike. In front of, you can see that. He has given me that video now. Whatever, yadi hasti tadanatra, enna hasti na tat kvachit. Whatever it is present in the Ayurveda, it is present everywhere. But we should have the confidence. This type of cases will definitely encourage and boost our system and our courage. Definitely, we can see that. And one more thing. Now, whatever he said, now he's working freely, and he is not with follow up me. Now, I told sir, ನಾನು ಕೆಲಸ ಮಾಡತೀನಿ, ನಾನು ಮೆಡಿಕಲ್ ಶಾಪ್ ಅದರಿ, ನಾನು ಮೆಡಿಕಲ್ ಶಾಪ್ದಾಗ ಎಲ್ಲ ಕೆಲಸ ಮಾಡ್ತೀನಿ. ನಾ ಮನೆಗೆ ರಾತ್ರಿ ಹೆಂಗ್ ಹೋಗ್ತೇವ, ರಾತ್ರಿನೂ ಗಾಡಿ ಮೇಲೆ ಹೋಗ್ತೀನಿ. he told that. ರಾತ್ರಿ ಮತ್ತೆ ರೋಡ್ ಎಲ್ಲ ಎಲ್ರಿ ನಾನು ನಡಿತೀನಿ ಹೋಗ್ತೀನಿ. he's given. But this much of is enough for me. When the blind has got the eye vision, I don't bother. No investigation. ಏನು ಬೇಡ ನನಗೆ ಸಾಕಿಟ್ಟೆ. This much. I am riding the bike. I am doing my work. I don't want any investigations. I don't want any further treatment also. He told. This is the, I won't use the miracle of the word, because that even when I say that miracle, that sir will scold me, definitely. So, and next, one more case. The next slide, please. This cellulitis. This patient was admitted for 1 month in the hospital, and I have later on there was no changes, increasing day by day, and they told that surgery, different. And again, this patient came to me. This right leg cellulitis with type 2 diabetes mellitus, and here I did Jalokacharana. What I told you, first case, what I narrated, I explained. He is the first case. He referred to me. This person from, and next after Jalokacharana, you can see the result. Next, you can see result. You can show the next slide. This is the result, and this was appreciated by all doctors. This result was irrespective of allopathy, homeopathy. They are told, really, doctor, cellulitis, Ayurvedic is the remedy. Next slide. Next slide. Literally, this boy is working as a bank. He's a bank employee. You can't see that. When he starts to cry, sir, you can't. Even I used to cry. That type of pain he is having. He has, with all proctologists, he has taken treatment, and everyone surgery, and IND, they tried everything, and it was totally, it says that the total whole anal, you can see that ichthyorectal area, perianal area, totally it was necrosed. And soon he came, and I told him that do Siddhsvat first. He told us, sir, I applied all these ointments, everything. Sumaga, Danting, everything I applied. I have taken almost all antibiotics. I have taken almost all anti-inflammatory drugs. Chimeral Fort, I have taken ceratopeptase, ibugesic, diclofenac. Almost all painkillers I have taken, but I have not reduced the pain. Soon after he came, I applied Jalokas. At a time, I applied 5 Jalokas. And I have drained more than half liter of pus from this side. And after that, daily I used to do Ropana Chikitsa with Kasi Sadi Taila and Jatali Taila, and I used to do wash, irrigation, and Dhupana also I did. Next slide, please. And even I did Basti for 7 days continuously for this patient with Jatari Taila. See the result. After that, when I lost his last picture, and I asked him, I requested, when Gita told that if any special case, you can give the compulsory last result. Then I asked him, please give your last pick, and he has given the result. No, before previous only previous. This is the snap sent by him. This is the result. So almost all I have treated. That's why I believe Rakthamokshana is half of the treatment. By I trust, you may trust, you may not trust, feel that 100% by Rakthamokshana, we can treat all such type of diseases. These are the cases what I have treated in my clinic, and I have seen the excellent result. And one more thing, last, this is not related to next slide. If you want, this is very wonderful case for me. Shall I show that one?
Yes,
Next
yes.
slide. Next slide. This is the COVID case. In the COVID-19 period, this patient used to stay in. Please, 1 minute, Vinith, 1 minute. What I say that in the COVID-19, he has got COVID in Mumbai. He was admitted in the super specialty hospital. They have charged him 25 lakhs rupees. After that, they told that within 24 he is going to do. You can see, play the video, Vinith. See, with BiPAP, they have ambulance only, they have charged 1.5 lakh rupees to bring his village. And I went personally to his house, and ICD which has given, then they have told that what you can, that BPF, bronchopulmonary fistula, you can, everything you can say that. And literally I am telling that his village is more than 30 to 50 kilometers far away from my place. Regularly I used to visit with PPT kit, and I have treated. And when I given the medicines, this patient, literally in the morning, his son told me that, sir, my father is not breathing. My father is not breathing. Sir, I am not having the hopes. No. Then I told that early morning at 5:30 or 6 o'clock, he called me. I was in a position that I used to do yoga in the morning. And I told him that, start. I was chanting the Mrutyunjaya Mahamantra. That is, really I'm telling you that Daiva Vyapasraya Chikitsa, how it will help. Mahamrutyunjaya mantra I was chanting. That time I told that just on the speaker and chant, just keep it near the ear of that patient. Then I started chanting the Mahamrutyunjaya mantra, Om Trambakam Yajamahe Sugandhim Pushtivardhanam Urvarukamiva Bandhanat Mrityor Mokshiya Mamrutam. 21 I'm chanted, and I told that I have given him that Loha Tamra Suvarnadi Yoga. Loha Tamra Suvarnadi, I told him that apply on the lips. You mix with 2 capsules of Loha Tamra and apply on his lips. Then he told that within 10 minutes, sir, he is opening the lips. Then I told it, if he is opening the lips, then apply inside of the lips. Then they applied one more Loha Tamra Suvarnadi Yoga and the drug with Hemagarbha Potali Rasayana. Hemagarbha Potali Rasayana, apply with lip and apply on the tongue. Then he told that he is opening the lips, and you can see after 24 hours he wake up and he told that give me food. Give me food. That literally whatever with him came, ನಾವು ಮಣ್ಣು ಮಾಡೋಕೆ ಹೋಗಿದ್ದವ್ರು ಇದೊಂದು ನಾವು ಒಂದು ಮಣ್ಣು ಹಾಕಿ ಹೋಗೋರಿದ್ರಿ ಅಂತ ಹೇಳಿದ್ರು. I should not show all his, but you should not disclose the, because according to medical ethics I ask apology to all people. I should not disclose the patient's personal history. So I I apologize even to patient also. And after that, with our Ayurvedic treatment, he started working. He's a builder in Bombay. Now he is completely cured. His lungs, he's working. HRCT reports everything. I can only one day it will take. One class, one lecture will take for this case only. But ultimately, you can say this result. I can say Thank you one and all to because last Dushtrasrabhavate Sadhya Shofa Raga Ruja Shama. Sadhya Raga Ruja Shamam. That's why with confidence I can say Rakthamokshana is half of the treatment. I can say it is a full treatment. At Basti you can consider in Kaya Chikitsa. Like that you can treat with Rakthamokshana. So I will thank to all Dr. Shakuntala Patil Madam and Dr. Geeta for giving me a golden opportunity to share my 20 years experience with this Raaaous platform. I will be thankful to all of you. Thank you one and all.
Thank you, Dr. Basavaraj. I have no words to appreciate towards your successful stories where we don't even dare to touch or see such cases. Even I was unable to see that cases when you showed that wound cases and all. No, literally, I used to faint by seeing that. I felt nauseatic feeling and all. Really. Even I treated with the Jaloka so many cases, but I never dared to touch such type of wounds. Actually, I don't like to see such cases. That's why I avoided in the such cases. Really, I appreciate you. I request everyone to unmute and give a big round of applause to him. Welcome, Dr.
And
Shashikant.
no, I will say thanks. So first, Geeta,
Yes.
this presentation had made this successfully by Vinith. Those he's sharing the slides. No, my laptop is not working right now. To be frank with you, he is sharing the all slides, and with me he seated for 24 hours, 3 nights he spent it. He's an engineering student. He's my friend's son, and I am thank you to say thank you, thankful to Vinith Biradar.
Thank you, Vinith, once again from our end also. Thank you once again.
Thank you,
Okay.
Basu. Thank you, sir.
Now here in our platform, I am seeing 4 of our classmates. Dr. Shashikant is here, and Dr. Basavaraj, Dr. Kanchana, and me. We all are classmates. We are from the same college.
It's my pleasure that we are having a good friends and they have encouraged me, and really I'm very
Doctor. Shanazari.
Dr. Basavaraj, shall we take some questions?
Yeah, definitely.
Okay. If anyone having any queries, you can chat it in the chat box, or else you can raise your hand. I can unmute and you can ask the questions. Dr. Santosh.
Sir, namaste. Sir, hello.
Yes,
Ma'am,
you can go ahead.
may I audible? Madam, yeah. Okay.
Generally, all solutions I will clarify previously.
Sir,
Everyone will ask their questions. Whether you apply the Jalokas repeatedly or not. Questions. What from the audience side? I will say that once in a week you can apply without any hesitation. Every time you have to purify the Jalokas and you have to give the one to Jalokas. And everyone has this misconcept that if you after using Jalokas, if you apply to any other people, HIV or any other infection should spread. No, never. And the National Institute of Virology has given a clean check that the HIV virus will survive only in human beings and monkeys. That's and you can apply more than 5 or 10. I have used I told you that 30 to 40 times I applied the leeches also. And one doctor that I have treated a hemorrhage. That patient was having 6 grams of hemoglobin, and his relative is a surgeon. Bleeding is there. Applying the leech, bleeding, and suddenly he admitted the patient in the same case.
Dr. Basavaraj, your voice is not clear.
I think sir is not well. Maybe network issues or something. Indeed, Geeta, it is a wonderful session from Basavaraj sir.
Thank you, ma'am.
Yeah, thank you so much for introducing to webinar.
Thank you,
Yeah,
ma'am.
yeah, it is totally different cases and very rare cases. It's not like the common cases what we treat. Like it's not that cellulitis and wonderful results. It is just awesome. There is no words actually to explain about the class. That is the thing.
Yes, ma'am. Thank
I
you.
think sir has exit from this thing.
I'll call and confirm, ma'am.
Yeah, please do. And share sir number because many are asking. Share numbers. Sir number.
Thank you, one and all. Thank you.
Thank you so much, sir. Vinit sir, are you there? Vinit sir? Gita, have you called sir?
ಊಟ ಮಾಡೋದು ಇದುವರೆ ಸಿಂಚನೆ ಇವತ್ತು ಕ್ಲಾಸ್ ಇದೆ
Gita, have
ಕ್ಲಾಸ್
you
ಇದೆ
called?
Yes, ma'am. Yes, madam. He is there. I think he is joining, rejoining. Sir number is posted in the chat box. Basavaraj, are you there?
Yeah.
Okay. Okay, Dr. Nivedita, you can
I am seeing.
ask your question.
Yes, sir, yeah.
Hello, sir. Good evening. Have you treated any? Hello. Good evening, sir.
Yes, you can go ahead.
Yeah, sir. Have you treated any snake poisoning cases? Snake bite.
I'm not getting you. Sir,
Have you treated
Snake-
any snake poisoning cases?
Huh?
Have you treated any snake poisoning cases?
Snake poisoning. Yes. Here, one lady met with the she is bitten by a snake in the area, and she developed AKD, acute kidney disease, and puffiness of the stomach, puffiness of the face, edema, everything was shows all over the body. It was present, and she came to the doctor within died from a special cell from and brought to me. I seen that the snake is simply I have given her matravasti with Sahajaraja and 3 days. And
Voice is not clear, Dr. Basavaraj.
Hello.
Voice is not clear. Your voice is not clear.
Now?
No, echo is there.
Oh, what is the problem with me?
I think you joined into this thing or what? Devices. Gnanapala, who is that?
You do no, just with only single one.
Not audible.
Sir, please unmute yourself. I have muted everyone. Please unmute yourself, sir. Basavaraj, sir?
Dr. Basavaraj, are you there?
Mostly ಎರಡು ಡಿವೈಸಸ್ ಅವ್ರದೇನಾ ಎರಡು ಡಿವೈಸಸ್ ಅವ್ರದೇನಾ ಅಂತ
ಇಲ್ಲ ಇಲ್ಲ ಇಲ್ಲ.
ಜ್ಞಾನ್ಪಾಲ್ ಸುನೀಲ್
ಅದು ಯಾರೋ ಗೊತ್ತಾಗ್ಲಿಲ್ಲ, ಬಟ್ ಈಗ ಮ್ಯೂಟ್ ಆಯ್ತು ಅದು. You all can post your queries in the Raaaous group so that we can convey all the question to him. Right, ma'am? Now it's already 5:40.
Yes, I think. And sir, if you wishes, please add sir to group also. This is great honor for us.
Sure, madam. Sure, madam.
It is great actually. And sir.
Ma'am, namaste.
Yeah, I think.
Ma'am.
Namaste, ma'am.
Yes,
Yeah.
Savitri.
Ma'am, I think if he is unable to connect, ma'am, I think we can have one more session from during nights, ma'am, like we have in our group discussion and all. Either on Thursday or Monday, so we can have him
Yes,
for
ma'am.
this
Even
question.
I was thinking the same, that we can invite him for the
during
discussion.
nights. Maybe he'll be free at that time, probably, ma'am.
Actually, Savitri, yeah, please ask Dr. Geeta, because Savitri, for 1 year we have waited for sir's slot.
So
Sir,
really, so amazing session, ma'am.
Yes.
Unable, maybe words are falling short to describe this session today.
He is calling. Just a minute, huh? Just a minute.
Yeah. Last April only we were planned actually for sir session, but sir was not available. And sir is having continuous busy with so many. Sir is busy with so many other social works.
He is going to join once again. Wait.
Yeah, I think this is good idea. We can invite sir for Raaaous classes. So there will be. It is more clear. Tomorrow is a Thursday class will be there. No, if sir is having tomorrow free, then we can invite tomorrow. Otherwise on Monday we can ask.
Anyways, all the members will be knowing, ma'am. Whoever is present today, they'll know. Okay, yes. He can connect tomorrow, like.
And many queries are coming for recording
yes,
sessions.
Ma'am. Yes, ma'am. Yes, ma'am. Because due to shortage of data, also many have left today.
Yes.
Probably that might be also one of the cause. So we can arrange like that, ma'am.
Yes. And by after that, Geeta, Veena for vote of thanks.
Hello.
Yes. Please, Amule, take the screenshot of the questions. Amule, are you there?
Ma'am. I'll take.
Yeah, please take the screenshot of the questions. Then we can post to sir, and later we can discuss in the classes too. If sir really have the
now
time.
He is joining in 1 minute.
And
We'll
I
wait
think
for
after
1
that,
minute. If it is not possible, we'll take him on tomorrow.
yeah, sir, we will ask now only. And after Vinay, are you there for vote of thanks?
Yes, sir. She is there now.
Yeah, done.
Even my favorite is Jalapka Charana. I
Yeah,
used to
but
do
I don't
number of Jalapka Charana. I tried in all the cases, but
Okay,
I
nice.
never touched such own cases and all.
Yeah, yesterday I had this varicose vein ulcer, which is very bad. It's really touching bones, that wound.
And I would like to share one of my cases. I tried in the corneal scar also. 1 minute.
Mhm.
ಅಲ್ಲಿ ಇಲ್ಲಿ ಕೇಳಿಸ್ತಾ ಇದೆ, ಅಲ್ಲಿ ಕೇಳಿಸ್ತಾ ಇದೆ. ನಾವು ನೋಡು. ಇಲ್ಲ, ಅಲ್ಲಿ ಕೇಳಿಸ್ತಾ ಇಲ್ಲ. He can hear our voice, it seems. We are not hearing his voice. I don't know where it went wrong. Okay, we'll do one thing. Now, anyhow, time is running out. He agreed to come tomorrow night to join the class. There we can discuss the queries and all. And now I'll request Dr. Veena to say vote of thanks. Dr. Veena.
Gita sir is there.
Can we hear? Raj?
Yeah, I can hear.
Okay. Okay, now we'll take some questionnaires. Sorry, Dr. Veena.
I think Geeta, we can continue. Sir, is it possible tomorrow? Because I think it will be, if it is time for another, ಅಂದ್ರೆ ಸ್ವಲ್ಪ ಜನ ತುಂಬಾ ಕ್ವಾರೀಸ್ ಇದೆ ಸರ್, ಅದೆಲ್ಲ ಕೂಲ್ ಆಗಿ ಒಂದೂವರೆ ತಾಸು ನೀಟಾಗಿ ಮಾಡ್ಕೊಂಡ್ರೆ ಚೆನ್ನಾಗಿರುತ್ತೆ ಅನ್ಕೊಂತೀನಿ ಸರ್. ಟುಮಾರೋ ಇಫ್ ಯು ಆರ್ ಅವೈಲಬಲ್ ಸರ್, 9 o'clock class will be there for our Raaaous team.
Night 9 o'clock.
Night 9 o'clock.
ಓಕೆ, ನೀವೇನು ಹೇಳ್ತಾ ಇದ್ರಿ ಕೇಳೇ ಬರ್ತಾ ಇಲ್ಲ ನನಗೆ ಕರೆಕ್ಟ್ ಆಗಿ.
ಕೇಳಿಸೋಲ್ತ್ರಿ ಸರ್? ಸರ್ ನಾಳೆ 9ಕ್ಕೆ ನಿಮ್ಗೆ ಆಗ್ತದ್ರಿ ಸರ್ ಸಂಜೆಕ್ಕೆ ರಾತ್ರಿಗೆ?
Yes,
sir.
You can ask questions. Okay.
Sir, questions can be, ಅಂದ್ರೆ ನಾಳೆ ನಾವು ಮಾಡೋಣ್ರಿ ಸರ್ ಥರ್ಸ್ಡೇ ಕ್ಲಾಸಿಗೆ. ಥರ್ಸ್ಡೇ ರಾತ್ರಿಗೆ 9ಕ್ಕೆ ಆಗ್ತದ್ರಿ ನಿಮಗೆ ನಾಳೆಗೆ?
ಡೆಫಿನೆಟ್ಲಿ
ಆಗ್ತದೆ ಸರ್. ಅಂದ್ರೆ ಬಹಳಷ್ಟು ಕ್ವಶನ್ಸ್ ಅದಾವ್ರಿ ಎಲ್ಲಾರ್ಗಿನು. ಸೊ ಈಗ ಟೈಮ್ ರನ್ನಿಂಗ್, ಅಂದ್ರೆ ಟೈಮ್ ಆಗ್ತದೆ ಅಂತ ಹೇಳಿ ಅರ್ಜೆಂಟ್ ಕೇಳೋ ಬದ್ಲಿ ಕುತ್ಕೊಂಡು ನಿಧಾನಕ್ಕಂದ್ರ ವಿ ವಿಲ್ ಲರ್ನ್ ಫ್ರಮ್ ದಟ್ ಕ್ವಶನರಿ ಸೆಷನ್ಸ್ ಆಲ್ಸೋ ಅಂತ. ನಾಳೆ 1 ತಾಸು ಸಂಜೆಕ್ರಿ ಸರ್ ರಾತ್ರಿ.
Sure, madam. He'll do. Don't worry. We'll share the link for all the Raaaous members, and we can add one this thing line for the questionnaire session for today's this thing for tomorrow. We can clarify all the doubts with him. Now we'll go for the vote of thanks.
Yeah, same link will be there for tomorrow class 9 p.m. also, and it will be recorded. Yes.
Okay, sure. Now, Dr. Veena, please.
Good evening, one and all. On behalf of Raaaous team, I am glad to express my sincere vote of thanks. At the first, my sincere gratitude to our guest speaker,
Veena, are
Dr.
you there?
Basavaraj.
Dr. Veena Kumari?
Yes. She is saying, ma'am, you unmuted. You muted.
Am I audible, ma'am?
Yes, Veena, you go ahead.
Okay. At the first, my sincere gratitude to our guest speaker, Dr. Basavaraj Swami, sir, for the participation in our 38th webinar. Thank you, sir, for your valuable time. Your presentation was very informative, engaging, and thought-provoking. It was great visuals and well explained and treated cases. It was amazing to see your confidence in Jalauka Charana and your explanation about the importance of Jalauka and Lord Dhanvantri hand. Thank you again, sir, for your willingness to share your expertise with
ವೀಣನ್ ವಾಯ್ಸ್ ಆಡಿಬಲ್ ಇಲ್ಲ.
ಮ್ಯಾಮ್ ನಮ್ಮೆಲ್ಲರಿಗೂ ಆಡಿಬಲ್ ಇದೆ ಮೇಡಮ್.
ಹೌದಾ?
We hope to have you back as a speaker on the Raaaous platform for the forthcoming webinars. Thank you so much, sir. A wholehearted thanks for all the participants, the delegates for their attendance to make the webinar a grand success. Thank you so much for your support and expect the same in the future. Thank you so much, Gurukula team. Thank you, Dr. Kanchana ma'am, for the prayer. Thank you, Dr. Amulya, for introduction of our respected speaker. Thank you, Dr. Geeta Puttur ma'am, for smoothly handling the session. And thank you so much for the speaker. Our sincere thanks and gratitude to our humble founder, Dr. Shakuntala ma'am, for the Raaaous platform. Thank you all. Thank you once again. Thank you, ma'am.
Thank you, Dr. Veena. Thank you, Basavaraj, once again. I'm added your number to our group, Raaaous group. Please welcome to our group. And tomorrow I'm expecting you on our another platform here in Raaaous group. Okay, tomorrow you may clarify our all doubts. Okay, thank you once again. Thank you one and all. Ma'am, anything to say?
Thank you, Basavaraj sir, for your time, and thank you all the Vaidyas for joining class and sitting for 3 hours. You are continuously here for the sir session. Thank you so much. And yeah, let us take a leave. It's already, I think, 6 p.m.
It's already 6 p.m. We have to run to the clinic again. So everybody will be in a hurry. Okay. Hope see you all tomorrow evening, 9 o'clock. Okay.
Okay.
Yeah.
Bye. Thank you. Thank you, everyone. Ma'am, one pic. Please come on to this thing, video. Everyone.
I'm on. Could not able
Basavaraj,
to.
if you are there, please switch on the video.
Savitri madam.
Hello. Basavaraj.